Kantai man tunat nyagi toru ilugar para honra para gloria abiba islasen para honra para gloria abiba islasen para Gitodu itempu ipas para ita dan gini langit na bendisyon Kontrai peligro na fansafuham Deus protege islan Guam Kontrai peligro na fansafuham Deus protege islan Guam.
Good morning, Guam.
Off today, everybody.
Morning. Good morning on you. It's Containing COVID, the KUAM News Takeover 611, Tuesday, the 31st day of March. And it goes on. Life under mandatory social isolation orders.
What day are we on? 11? We were talking about this yesterday.
Yeah.
10 or 11, I think.
No, it's week three.
Week 3.
Yeah.
I'll just leave it at that.
Week 3. Jay, do you know?
Okay, we started on the 11th.
We kind of shouldn't. It's not a good sign.
No, we started this show on the 11th, which was our first.
Yeah, we're talking like how many days have we been under mandatory social isolation? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Day 16, guys.
All right.
Okay, day 16.
Okay, guys.
2 weeks and change.
Off.
Yeah. Day 16, of course, this is week 3. The extension is in effect, the extended remix of Containing COVID. It's 6:12. There's a lot of information to get out from you guys, and we've tried to line up a lot of people who can give us that information. So good morning to you guys on the Facebook live feed, and to our listeners out in Radio Land. Good morning on you.
You're so awake.
I am.
Must be the coffee I
It is
made.
good coffee. Bree made the coffee this morning.
You're very woke,
Pretty good.
as the young people would say.
He's woked. Let's
Even though I thought I broke the coffee machine, but that's okay.
yeah, you
We
definitely
should talk about that. That's a good story to get the show started.
Yeah, so
I almost broke the coffee
I got
machine.
a desperate call from Sabrina on my way in, and I was on the other line, didn't answer it. It came in. I don't know what you did with the coffee maker, but
That wasn't it.
yeah, she had it like I don't know. It wasn't.
I didn't put it in right.
Yeah. Okay.
So it started to beginning to overflow,
It was
and I had to stop it. and
Yeah.
help.
So you're one awesome newswoman, but home ec maybe not so much. But hey, that's not what matters, is it? Let's get right into the information. The latest update from the Joint Information Center. Good morning, Chris Barnett, Sabrina Salas-Mantanani.
All right, the Department of Public Health, as of the latest results, these were released at 6:30 p.m. yesterday by the Joint Information Center. They tested a total of 20 individuals for COVID-19 with conclusive results. Two tested positive and 18 tested negative. The overall count includes 2 positive cases that were tested by Naval Health Research Center in San Diego. To date, a total of 58 cases tested positive, with 7 patients who have recovered and 1 death. Also, overnight at midnight, the new quarantine protocols went into place. That means that all incoming passengers, regardless of where they came from, are subject to a 14-day quarantine at the government designated facility. The quarantine, however, is not applied to those travelers who have the 72-hour medical clearance clearing them of COVID-19. Again, the total number of confirmed cases of COVID-19 on Guam stands at 58. Meanwhile, in Saipan, they announced yesterday, a late afternoon press conference, that they have 1 suspected COVID death. Here's more from that press conference.
Governor Ralph DeLongero Torres, Governor Ralph Dulong Torres, the governor's COVID-19 operation force, and the Commonwealth Healthcare Corporation has confirmed that one patient suspected of COVID-19 has passed away today, March 30th, 2020. Specimen has been sent out to Guam Public Health Lab, and we are awaiting the results of COVID-19 testing. Guam Public Health Lab has assured us of making this test a priority as soon as it is received. This patient was a 70-year-old elderly male CNMI resident. He was seen at CHCC on March 25th and was considered to be a person under investigation, a PUI. Based on this clinical determination, CHCC issued an order of quarantine for the patient and his wife to be cared for at Kanoa Hotel, the designated quarantine location. Unfortunately, he has an underlying multiple medical conditions. A treatment plan was offered, but next of kin opted for comfort care at the hotel, which was adequately provided. The deceased male had no travel history, but contact with someone who had tested positive for COVID-19.
Sabrina Mazzoni from KUAM. I did want to follow up on the information that you guys relayed. You mentioned that the 70-year-old man was seen at the Commonwealth Health Center on the 25th. Can you hear me?
Yes.
Yes.
So he came in on the 25th, and one of the COVID positive patients there also came in to the center on the 25th. Would the contact then have occurred at the CHC? And if that is the case, what are you guys doing there to minimize the exposure to people that are coming into the hospital?
We can absolutely confirm it did not happen at the hospital. We're taking all kinds of precautions. We aren't letting in a lot of visitors. We're doing social distancing. Staff is wearing masks. We've taken great care to keep the hospital safe. We had the tent out in front to keep anyone who has a question, who may have COVID, to be seen at a space outside, not coming into our hospital. We've taken great precautions for that.
Okay. And then my follow-up question then would be, then if it's not through the hospital, could it be through this faith-based organization that was mentioned during the press conference on Saturday night?
Well, I think at this point, we can't say, we don't want to mislead the information as to what could be or what could not be. I mean, we all know how COVID-19 is contagious and contaminated from one to another, so we just cannot make that assumption or
I would say also, we may be having community trans. Don't assume it was just in one place. Assume it's everywhere. Everyone needs to be careful. Everyone needs to stay home. Everyone needs to wash their hands. It was not just in one neighborhood. It is everywhere. Assume it's everywhere. A lot of people don't have symptoms. Even if you feel well, you need to wash your hands. Don't touch your face. Don't touch your mouth. Don't touch your nose. Wash common surfaces. Assume everyone has it. Assume that you have it. Protect other people who you are near, and make sure that they are protecting themselves as well.
And Governor Ralph Torres holding a press conference late yesterday afternoon announcing the death of a possible COVID patient. They're waiting for the results to return from Guam's Department of Public Health lab. In national news, a naval hospital ship Comfort made its way to New York City today to help with the coronavirus crisis gripping hospitals. In another part of New York City, another emergency hospital, this one being constructed in Central Park by the humanitarian organization Samaritan's Purse. The CDC has issued a travel advisory telling everyone living in New York, New Jersey, and Connecticut to avoid all non-essential travel for the next 2 weeks. Rhode Island officials say they will be stopping New York travelers and asking them to quarantine. The governors of Oklahoma and Texas say anyone traveling to their states from areas with hotspots will need to self-quarantine. Both are close to Louisiana, that has a second second highest number of coronavirus deaths per capita. In Michigan, cases are doubling every 3 days. In Illinois, the governor says he's still waiting on thousands of ventilators from the federal government. And in Los Angeles, the naval ship Mercy took its first non-coronavirus patients to help that city with hospital overcrowding. The Mercy is a 1,000-bed facility staffed by more than 800 Navy medical and support personnel. As for news back here at home, the governor, as we reported over the weekend, signed an agreement with the U.S. Department of Labor regarding benefits for people that were displaced here on Guam as a result of the coronavirus crisis. Here's what she had to say during her press conference on Monday.
Good afternoon, Governor. As you know, the legislature will meet tomorrow. This will be the first time they're gathering in session since this whole crisis started. And as we understand, there's going to be a whole slew of bills that will be geared towards addressing the coronavirus crisis. Everything from raising the ceiling on the Dave Santos Act, waiving, I guess, the set aside for the rainy day fund, rolling back the BPT, rolling back the liquid fuel tax possibly, and possibly even overriding your veto of the $1 million transfer authority. Can you comment on session tomorrow?
Yes, I don't exactly know what their agenda is tomorrow, but of course, the senators are elected officials and they have constituents that they have to respond to, and they're just as concerned as you and I and everyone else about the status of this coronavirus. They're wanting to make sure that the public is given enough financial help. They're wanting to make sure that I am also provided with the policies and the resources that I would need in order for us to battle this viral nightmare. And so, that's within their purview. They can hold their session anytime they want to. That's their authority. And if those policies that they are going to be looking at and passing is going to benefit more in terms of helping our people, I would look at that very closely. But I just want to also inform you that most of the ones that they're looking at is to provide direct cash to our people. And we are already doing that from an executive level through the federal government and the White House and the other and Congress. So they are pouring in, a lot of financial help for not just individuals, but for businesses, for the hospital. They're pouring in a lot of that for us and also the 50 states of the United States, because everyone is suffering from this virus. They're suffering economically, they're suffering financially, they're suffering with their lives, most importantly. They're suffering from anxiety, they're suffering from, being staying at home. Our whole life is being changed by this virus. So whatever the senators can do to help, that would be much, I think, appreciated from us. But I need to also weigh out
hours to the Guam Department of Labor. Again, that was Dave Della Sola. You're urged to email the information at rapidresponse@dol.guam.gov. And that is, of course, for individual employees. You can send your information to that email, as well as for business owners or managers. Meanwhile, senators, they were scheduled to go into emergency session today. Nestor Lecanto asked the governor during our press briefing on Monday about what she was anticipating or what we could expect.
Governor, as
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
From us, but I need to also weigh out what does that mean in terms of our recovery? What does that mean in terms of future sources and revenues so we can continue providing public safety, health, and education?
Again, that was the governor yesterday. Today, session has been postponed until further notice based on a letter that she sent yesterday where she wrote, "I'm very appreciative of the Guam legislature's willingness to address growing concerns because of the spread of COVID-19 on Guam. However, I caution that to develop programs locally using local funds may duplicate federal programs currently enacted to give relief to businesses and individuals. I would prefer holding on to our local funding, which is needed to pay for costs up front by the local government to respond to COVID-19. It is clear that COVID-19 may be something that we will battle for many weeks to come." And then last night, Speaker Tina Munoz Barnes sent out a press release and a letter to her colleagues that based upon receiving that letter, she's decided to temporarily postpone session to allow for the coordinated effort of the two branches of government to come together and do right by our people. She says, given that this is a matter of life or death during times like these, we really need to rally behind one plan of action, and I implore my fellow public servants to come together and join our MAGA Haga.
Okay, and we'll definitely have more on that later on. Let me just say, understatement, there's probably a few senators who got something to say about that.
Okay.
Yeah, but let's get Dr. Felix Cabrera. He's from the Governor's Physicians Advisory Group on the show. Good morning, Doctor.
Good morning, Chris. Good morning, Sabrina.
Hafide.
So we weren't really sure where to start. I guess just maybe where are we at as far as the testing? I know that the last 3 days we've only conducted 20 tests. Does this mean that we were kind of finishing up the limited priority group, Doctor?
For the most part, right now, you could say that. But the reality is that, I'm sorry, I'm getting an echo here. Do you mind if I call right back?
Sure. Maybe you can turn down your radio or.
Yeah, I don't have anything. Okay, there. Actually, echo's gone.
Okay,
Sorry.
good.
Okay.
Okay. So the priority testing group is for the most part caught up. But the harsh reality is that regardless of what's reported on a daily basis of how many positives there are on Guam, we have to understand the main caveat in these results, or in other words, the main underlying issue that you can't use it to necessarily relate to what the presence of COVID is on Guam, because we've limited the testing and we restricted the testing to priority groups. So in other words, people who have symptoms that are consistent with COVID, but they're doing fairly well, when they call into the clinics, for example, or call into the hotline, they're advised to not come in to be tested if they're doing relatively well. So the number of positives we have is not reflective of what's actually in the community anymore. That was a very different case last week when we had those numbers, and they were fairly reflective, and that's what some of our graphs were using. But as soon as we made that restriction, we could no longer use that as a tool to correlate with what's the actual trajectory for the disease on the island.
Right, and it is a little confusing trying to explain to people that that's why we're seeing these lower numbers, is because we kind of said, you guys got together and said, hey, most vulnerable group is going to be the healthcare workers and elderly who are exhibiting symptoms of COVID-19, elderly who are in ICU or otherwise hospitalized. And so we understand that you guys were kind of going down and testing this priority group because they were the most likely to be the most vulnerable to COVID-19.
Correct. Yeah, and the reality is that the vulnerable group are not the main carriers on the island, and they're not the main spreaders of the disease. It's everyone else, and so that's why our common call is for everybody to assume that you have it and assume that everyone else has it, and to take the precautions necessary with that assumption, which could be a very, very real assumption. It doesn't second guess the decisions made from last week in terms of restricting the testing, because that was very important to treat the most sick. But the reality is that it gives a skewed view of what's happening on the island right now. Based on our current estimations, that we're probably about 3 weeks behind what we're seeing stateside, in particular like New York, and so we're still in the very, very, very early stages of this war.
Right, Doc, and I just want to go back to what you said, is that people are seeing these results. Maybe they're not understanding that we're testing fewer people, but what they are seeing is fewer positives. And is it dangerous for people to assume that means that we're flattening the curve?
Yes, and so make no mistake that the efforts that everyone is doing is working. It's definitely working. It's helping. It's just still far, far, far from enough. And so it's definitely making an impact. We're seeing the curve, kind of make a dent, so to speak. But it's still far from enough for us to avoid the most catastrophic situations that we could be seeing in the next 1 to 4 months, actually.
So just to clarify, are we just running under the assumption that everybody has it, therefore we don't need to do a lot of tests, or do we just not have the number of tests that we need to go out and test, 200-300 people?
Yeah, so our recommendations for testing are going to continue to evolve as we have the availability to test, and then our criteria will continue to change. Again, there are different point of attacks for how to use testing. And so advising the public that with the assumption that everybody has it and that you might have it is more for behavioral parts in terms of them complying with the governor's orders. But for the actual medical practice of testing and the decisions are made, that's going to continually evolve. We're working extremely diligently to open, to try and look at all these multiple avenues. We're talking about 10 to 20 different pathways. We're trying to get more testing on the island, and so. But the reality is that every single state and every single county is going through the same thing throughout the country, and so we feel like we may be ahead in line in some of these pathways, but we still don't have a good timeline for when we'll get them.
Dr. Cabrera, I wanted to just follow up on whether or not there's a backlog of cases from people in the community that don't fit into the priority group.
I have not looked at their log in the past a couple of days. So they only ran one batch yesterday, as I understand.
And that was just for the priority group.
Yes, that was just for the priority group.
Okay, so there could be a backlog of swabs or tests from the community, because when people tell you and that they're all caught up, it seems disingenuous that it's not
No, so I think so. So when they say they're all caught up, that is also including the medium risk groups as well, because those are they're the ones that are put in the queue. So when they're saying they're caught up, it's with that. But then the number of samples that they're receiving from the outside clinics, for example, have definitely reduced because everyone's in a conservative mode right now in terms of even testing and sending, and so that's what we're seeing, and that's what's being reflected. So it's so we've been saying that a lot of some of these negative results that we get, they can be double-edged sword in that they can be dangerous in that there's a few steps of assumptions that the disease is actually improving on the island overall, but it's still extremely way too early to make that call. It's extremely way too early to let up on any of the isolation and distancing and hand washing and covering your cough recommendations, and that we have to be, in fact, more vigilant about it. Because again, we're like I mentioned earlier, we're about approximately anywhere about three weeks or so behind what we're seeing in other parts of the country.
Doc, where are we with the limited priority testing? Do you know? Are we just done with that now, and we're opening it up?
No. So that continues, and so what's the better marker for us right now is the amount of COVID positive patients that are admitted into the hospital. So those are real, because basically the real assumption is that whether or not you tested positive or negative prior to showing up at the emergency department, if you're sick enough because of COVID, you're going to show up, and then when you show up, you're definitely going to get tested, especially if you meet that criteria. And then if you're positive and you're admitted, that's to us a better trajectory of what's going to happen over the next time period. And so those are the numbers that we're looking at closely, and that's the models that we're using. It's still, again, an early stage, and the model has a wide range of variability, but it's something that is very scary, and it's something that we're looking at more. We're getting help with other sources to help corroborate some of the things that we're seeing, the numbers that we're seeing. But in the end, it's still our best assumption, our best estimates, and that's all it is. It's just like a super typhoon off that's down in a few thousand miles away, that we're trying to predict which path it's going to go. But the reality is that we could be hit very hard by a super typhoon like we've never seen before. And right now, it's just sprinkling outside.
Are we seeing an increase in PUIs?
I think the overall number in PUIs is still around steady, but that's right now what we would expect.
What is that number?
Let me see here. I don't have those numbers right in front of me right now.
What is average or steady?
It's anywhere between I think about 4 to 10 PUIs between both hospitals.
Wait, what do you mean between both hospitals? I thought only
because
GMH is a COVID designated
yes,
hospital.
Correct. And so, but what happens is that patients do still show up at GRMC's emergency department, and then we because for a number of different factors, and then at that point they're determined to be somebody who should be a person under investigation, and but at the same time, because of the logistics of transferring patients back and forth between both hospitals, again, that's not as easy as said. They may be there for a period of time. They're still in isolation. They're still in the isolation rooms that are within the emergency department. But we do try and get them over to GMH as quickly as we can. But they still definitely become part of the count during that wait time.
Just for clarification, the PUIs, when they're brought over to GMH in isolation, if they're not part of the priority group, are they not tested?
Oh, they're absolutely part of the priority group.
Okay.
So part of the priority group is people who come into the emergency room exhibiting the COVID-19 symptoms, right?
Yes. Yes, hence being therefore being a PUI.
So
wouldn't they not be a PUI if the test results are conducted? Right? Does that make sense?
So they're a PUI until we get the results back.
Right.
And so
and then if they're negative, they're clear. If they're positive,
but they still would be at the hospital.
Yes, correct. And so they
Okay.
may be, but these are people who are determined that need to be admitted anyway, because of so they're sick because potentially because it's not COVID. The other thing that we're trying to investigate also is just whether or not no test is perfect, and there's a degree of false negative results and false positive results. We're pretty confident about when a test is positive that it truly is positive just because of the nature of this test. It's pretty good in that sense. But when a patient shows pretty classic signs and symptoms of COVID, and if the test turns out negative, we still assume that they have COVID, and we still treat them as they do, and we still work them up for everything else. The differential diagnosis is still not on the table. It could be another reason. They could have just regular COPD exacerbation or something like that. But the point is that we are taking extra precautions, and that we don't 100% rely on test results solely by themselves. And again, I'm mentioning this within the hospital setting.
Doc, what is going to be the next category of people that you guys are going to test when you're done with the limited priority group? Or is that something that you can be done with, or can they both run at the same time?
Yeah, and so it's really hard to say right now in terms of how that's going to develop until we better get a better sense over the next a couple of days right now.
Is there any other information you could provide to the community? We had the governor on the show yesterday, and we asked about the U.S. Army Corps of Engineers.
Yes.
And their offer to retrofit a facility on Guam. Do you have any other information on that? And then she also mentioned that she received an offer about a barge?
A hospital barge.
Yes. And so that's actually what... with our state surgeon, Dr. Michael Cruz, who's who's leading this COVID task force, and we have our specific surgeon cell, and that's basically myself in there and Dr. Louis Cruz, who's a member of the Guard as well, and then other Guard members, and we're actively looking at all different aspects of readiness, for what's could potentially come over the next few weeks to next several months. And so part of that is a build up like that's been that's never been seen or even we've ever had imagined in terms of a number of beds that we would have to expand to.
Right.
And
the
so,
governor said that the goal is 2,000 beds.
Yes. And so, of course, we can't just build a 2,000-bed hospital, over the next 2 to 4 weeks. So, we're looking at other contingencies. There's a lot of different ways that we're looking at. Yes, this barge or a floating hospital, so to speak. It's something that could be converted. Something that we're looking at very seriously and making logistic plans for that. There are these type of pop-up tents, so to speak, that we're trying to procure so that would be part of this expansion. We're looking at different locations throughout the island as well. And so these, again, this is primarily for readiness, and that we're very much seeing what's going on. What's happening in New York, what's happening now in New Orleans, what's definitely happening very tragically in Italy and Spain, and now we're seeing more in France. And that we want to be sure that we do everything we can to mitigate that potential for us, and that we're ready if that tsunami hits us in that degree. But the reality is that right now, that's not our fate. We're not bound by that estimate and that trajectory, and that everything we do right now in this very early phase could prevent a lot of that. And so that's why it's so important that everybody step up your game, so to speak, in terms of not just doing things for yourself, but keep your family accountable. Call them out, and so if they're not practicing what we're preaching and what we're trying to ask the whole public to do, then we need their help in terms of doing that. And so that's why it's so important to look at it from both aspects. And so we the medical community right now is we're trying to communicate with them about this readiness plan as well, and they've been good, but understanding why that there's this basically the operation from the guard in terms of readiness, and trying to be the main center that actually gets accounting for all the resources that's necessary to build up to at least 2,000 additional hospital beds.
But you can prepare for 2,000 hospital beds, right, and prepare these facilities, but what about personnel, medical people?
Then that's like the very next question that everybody asks, including us as well. That's a parallel process. Our very first priority, of course, is if we were to reach this nightmarish situation, that we got to figure out a place to put them, to put our patients, to start caring for them, and then at the same time now, that's why more important now than ever is that we look at all the medical professionals on island. Anybody who's been to medical school but doesn't have a license a U.S. license to practice medicine that are here on Guam. Anybody who has nursing training, EMT training, who's been a medic in the past. Those are all things that we're trying to get a good inventory of right now, and that these emergency allowances will take place if necessary to give them the ability to help in this war. And so this is very serious, and we're taking it extremely seriously. We pray to God that we're wrong, and that this is just going to be a great exercise overall. And it's something that we should exercise anyway. How there's war games. This is I hope that this is just germ games, and that we're practicing. Bill Gates is the one who coined that term.
Yeah.
And so we hope that that's the most of what this is. But readiness is key, and readiness will save lives.
Doctor, I want to ask you. You gave that presentation. You raised a lot of eyebrows. Very alarming presentation. The numbers we've seen after that don't necessarily match up with what you said. So how important is it for people to take what you said in that presentation seriously? And do you still stand by what you told the people of Guam?
Absolutely. And so what the analogy that I've been using, so the presentation from last week was a way to address the first grenade that was thrown at us, okay, and how to dodge that grenade, how to get away from it, and so that we are not hit by the first attack. And so that's what the graphs that were used was all about, trying to understand what was the actual threat and how to get away from it and how to suppress it. But right now, so to all of Guam's credit, we avoided that first grenade. And I think that's extremely important. Now, in the process, we still did lose, one life, and that's a very valuable life, and every life matters. But in the grand scheme of things, we did avoid that very first grenade. Now we're talking about the entire war, and now we're looking at numbers to try and it's like trying to predict any war's numbers. There's a large degree of variability. But that's the numbers that we're looking at now in the trajectory. So I definitely stand by the numbers from last week. It's just that now it's a different. Now we're looking at a whole different part of the this war with COVID.
I wanted to follow up on what's happening over at the quarantine facilities, because we received confirmation that I believe it was on Sunday, there was an individual who was displaying flu-like symptoms and was transported to GMH and is there as a PUI. How concerning is that to you?
That's the first I'm hearing specifically about that. And in terms of the because I don't know what their status is right now. I don't know what it is, but that's though if you just think about the pure odds, that's why quarantine is important, is that we would expect one or two people to potentially start showing symptoms and maybe more, and that's why quarantine is so important.
Okay, Doc. I know we said 5 to 10 minutes.
But
45 minutes ago.
There was something else.
If you don't mind, I just like to make a couple of pleas out, and I think these are important tips that I picked up recently. We talked up again about What's going to be the big flood to this that could potentially surge, our hospital and our healthcare system. Just a reminder that there's about, in terms of how many persons above 65 years old or above on Guam, that's about 8.9% of our population, or over 15,000 people. So just that by itself, there's over 800 dialysis patients here on island. If they all got sick at the same time, you can imagine what kind of horrific scene that might be. And so we absolutely want to avoid that. But so that's why, again, protecting them is very important. But I want to give some very specific tips, if that's okay, about protecting the vulnerable within your own household. And some of those are things that we don't think about as well. Like they should sleep in a different part of the house in a well-ventilated room. If possible, you have them use a separate bathroom. And reduce the number of people in the house. Don't have visitors. Air out the house when possible. Obviously, wearing a mask is important as well. Do their laundry separately. Don't share objects like a phone. And if you do use a phone, speakerphone is the best option. Clean the surfaces at least daily. Clean your phones as well, of course. Remotes, light switches, doorknobs, those are important. And then, of course, touching your face it's built into our DNA. Babies in utero touch their face, and we use it as a soothing mechanism. But ironically, during these stressful times, it's even harder to avoid doing that. But there are things that we can do to remind ourselves not to do that. So one of the things I've been saying is pretend like you have a electric fence around your shoulder, and that if you put your hands above your shoulder, it's going to shock your hands. And so if you just kind of imagine that and how important that is, that might help be a reminder. If you wear a mask, that sometimes is a reminder also to not touch your face. Don't eat with your hands is another thing. But those are some of the tips that I wanted to just throw out there, because just these simple things can really make a big difference and can really help save lives.
Doc, I do have one more question, and I wanted to ask about the situation over in Saipan, because I know you were from there, and what sort of communications have you had with the task force over there?
Yeah, and so in particular, my main communication as of recent is with Dr. John Tadella, who's the medical director and the chief medical officer for the hospital there, and he was in fact the main physician caring for the patient who recently passed. And it's tough, and the first death is always very, very tough for the entire community. And so, he's right now, I think, he himself and the rest of the staff there, need the community support. The whole community needs to support the family of the deceased, but I think that they're doing a lot of right things right now. They've instituted a mandatory curfew for the entire island. I think that's what I keep saying is that there hasn't been, even Dr. Thane Hancock has been saying this as well, is that there has yet to be a country on this planet that has over-prepared for COVID. And I think that's a very, very powerful statement. And so I don't think there's anything we can do to be over-prepared for this. And I applaud the CNMI for taking the efforts they are right now. They took it very, very early, and thankfully their timeline is further behind, I think, the rest of the globe. We're also lucky that our timeline is behind, the rest of the in the United States and countries like Italy. And so we have to be grateful for that and learn from their lessons and continue to be more and more prepared.
All right. Well, thank you so much, Doc, for calling in. We really appreciate your time. And
I really appreciate you guys' effort. You guys are a major part of this battle, and keep doing what you're doing. You guys are your messages and your strength is important. I know that this has been tough on all of you as well, and it's been wearing down. But I really appreciate the messages of appreciation from the community. Trust me, that really goes a long way. It makes me bounce out of bed and want to get to work right away. And so those are very important, and I can't thank the community enough for that.
Okay, thank you, Dr. Cabrera.
All right, thank you. Have a great day.
Take care.
Wash your hands. 6:54. Hey, we got to take a break, and I believe we're getting Linda DeNorsi from the Department of Public Health and Social Services coming up. We'll do news. We're KUM-FM Magatni, Guam, containing COVID Tuesday, the 31st day of March. Good morning.
KUA.
Day Guam. This is Rocky Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please stay at home and stop the spread of the virus. Thank you.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Dave Delgado here for KUAM Sports. Thanks for watching tonight on the show. We're going to hear from UOG Athletic Director Doug Palmer. What's next for student athletes, classes, scholarships, and leagues? Check it out.
Pretty much we just tell them to stay in contact with the university's website and the information, that's there, and the public information that's from the actual offices of Gov Guam, and just don't follow a lot of the rumors and stuff that are out there. Go to official sites, but try to use the university as much as possible.
All University of Guam varsity and club sports are suspended until the fall semester. Guam and the university's move to online-only classes for the remainder of the semester were announced March 19th through a press release.
Yeah, no, the kids get to keep their scholarships. Actually, if they haven't used all their money yet, I told them to, get me in any other names that you have that we want to give a scholarship to for this past semester, what we were able to play. So, because the money that we do get for scholarships, we don't get to keep it for the next year. We have to get rid of it or it's swept. So we're going to try to spend every dollar that we have to the students. And so hopefully a few of the students will be getting some $500 type checks sometime soon to help them at the end of the semester.
The Triton women's basketball team will return to play on September 8th. The Triton women's club volleyball team is scheduled to start October 6th. The Triton men's basketball team will return to play on October 27th. Men's and women's soccer will return for play in the fall in the Guam Football Association leagues, yet to be determined, along with the newly reinstated men's baseball team, also a possibility for fall pending player recruitment.
I told the coaches to continue to recruit as best they can, mostly by, of course, telephone, social media, email, contact the high schools and try to get coaches' numbers and things, since we no longer have games to go see and play. So, and we're not sure when we'll be able to have tryouts. We may not be able to have tryouts until the fall comes. So we need to try to recruit as best we can. And most of the coaches are pretty much into basketball or soccer on the island. So they know the students that are recruitable. So we will start trying to recruit them and hopefully get, some recruiting classes.
For more information, contact Doug Palmer, Athletics Director for University of Guam at 735-2862 or email palmerd@triton.uog.edu.
Howdy everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together. This war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat, or happy birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News.
The soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
Be healthy. Be informed with ITD.
Peter Santos, the containing COVID 701. Yeah, Pete's awesome. Good morning. Well, thanks to Dr. Felix Cabrera. And let's just go right over to the phones. Some very valuable information coming out here from Public Health Director Linda DeNorsi. Linda, thank you so much for joining us this morning.
Thank you.
I guess just first of all, we'll jump right into it. Where are we on the testing? What groups are we currently testing as of today?
Today, actually, we tested yesterday, and we're all caught up as far as 20 tests were conducted yesterday, and 2 came out positive and 18 were negative.
Right, Linda, and I guess
And as far as the testing is concerned, the test kits, we have about 348 remaining, and we should be getting another shipment coming in this week.
I guess this first question, we noticed that, last week and I think the week prior, we kind of got used to you guys running the 40 tests a day. And so Saturday, Sunday, and then yesterday, we've only run
around 20.
20. So can you explain that?
That's what we're getting from the community at this point. So we're just running them as we get them. So, we haven't gotten 40 so far, and some, it's slowing down. So we just are running them as we get them, Monday through Sunday.
When you say 20, that's just from the limited priority group.
That's for pretty much the priority group as far as we're concerned. And if there's anyone that is going to be run, we wait and we prioritize them. But that would be inclusive of what we have.
So you mean to tell me in this time of mandatory social isolation and quarantine, we're being told that, it could get really scary, that clinics, is that where we're seeing it, that they're not testing people? We're really only testing 20 people a day? I mean,
no, the test can be up to 40, but right now the specimen samples that we're getting, we're running them in accordance to what we're getting. And recently I just sent out a memo. MIT Medicaid is also covering it directly, and it's paying. They're being paid by MIT Medicaid. So DLS is also going to be running those tests, and we notified that to the providers to let them know that. So DLS is also contracted with us, helping us to get those tests done, and those tests will be done also through off-island, either at the Quest, which is in California, or through Hawaii.
Do you know what the turnaround time for those tests will be with DLS?
Yeah, it will be about 5 days because they're going off island versus what we have here in Guam, which would be about 24 to 48 hours.
And what about a backlog? Do we have a backlog of any samples from the clinics or anywhere?
Right now, of course, they have to come through our department. If they have backlogged at their facility and they don't give it to us, then we wouldn't have that information. So currently, as of yesterday, I contacted my staff and they have about a couple to run this morning, about 18, I believe, and that's what they're waiting for more as they arrive, and so that's where we're at.
And so if we already have 18 to be run this morning and we get more, are we going to end up running the 2 batches?
Yes, that is correct.
Okay.
I did want to follow up on Saipan. If you have the results from the suspected COVID-19 individual that passed away.
Oh, what happened? We got the specimen sample, but it wasn't secured properly, and so they had to do a re-swap on that patient. So we should be expecting it shortly. So yes, they did do a nasopharyngeal swab. They did another one on that patient that passed away from CNMI.
And Linda, how are we going to juggle what the testing that we need to run here on Guam and also do the test that Saipan sends over if our capacity is only at 40 a day?
Right now, we could also send it through State Hawaii Lab. The U.S. API is, the affiliate Pacific Islands. And one of the reasons why Guam was selected as a laboratory is because we are also supporting the U.S. API. Otherwise, we may not have been selected. And so our justification on having our test kits and being selected to receive test kits is also based that we are a regional laboratory for the Pacific. How are we going to handle it? We will have certain slots. Dr. Thane and I were discussing that. We're reserving maybe about 5 tests for them a day.
So in a perfect world, we'll run 35. 5 will be from Saipan, and then DLS will also be running samples from the clinics.
But you said we were the regional lab, so where else do we receive tests from? Does this include like Palau?
Yes, it will be Palau, Marshall Islands, as well as the Federal States of Micronesia.
I saw something about Palau. Can you confirm? Is there a positive case there, as far as you know?
For Palau, no, not that I'm aware of. Most of them are CNMI that we've received so far.
There was a release from Palau, but I think it was that it was suspected COVID.
Okay, and then the tests were sent to public health?
I have to verify that with my staff because we receive so many spends every day. Right. So I have to get a specific. Right now we're having a different reporting for the CNMI and the U.S. API, and we're going to be distinguishing where all the tests that are done, so that we can segregate those out from our count. And that's what we've been doing. We've been segregating them from our count.
So, Linda, have you been getting samples from, Marshall Islands and FSM and stuff, or no?
Not right now. The ones that I know of, again, are from CNMI. But, again, I will look into that to make certain.
I also wanted to follow up on, initially when news was breaking about the USS Theodore Roosevelt, numbers were coming out of the JIC providing information that there were like 2 confirmed or whatever the number was at the time. And you mentioned on our show that it's required by law that the military has to report their cases, I guess, to you. And now we're not seeing this information from the Joint Information Center releases. So I'm wondering, what was the change?
Oh, no. As the governor had indicated, they are handling their own testing. And this is a test that they're doing, and
no, I understand that because they were handling the testing even prior when the information was released through the Joint Information Center. And do they still report it to you or to your agency in terms of the number of confirmed cases they may have?
Right now, I haven't gotten any information on that. So can you just allow me to contact my epidemiologist if there are any updates? But theoretically, I think that's something that you should ask Admiral Manoni at this point in time, specifically about the military.
Right, I wouldn't
Right,
be
right.
asking
Yeah.
if
I
we
mean,
weren't
but-
getting any response.
But Linda, if you said the law is that he's supposed to report it to you, I mean, shouldn't you be asking the admiral to report it to you? Or I mean, the governor calls the admiral every day.
Yeah, right now, again, as I speak, the ones that we got reported were the ones that went to the Naval Hospital and the ones that got the results back, and we included that in our figures. Of course, there were 2 positive cases at that time. So that's the one I'm getting from the Naval Hospital, and they do reside in Guam. So that's all the information I have as of today.
Okay.
Linda, how do we reconcile asking the community to, do the social distancing and the mandatory quarantine and to do all the measures to flatten the curve? And then if, the governor and you guys have routinely said that the way to flatten the curve is by doing a lot of testing, but we're only testing 20 people a day. I mean, is that problematic to you?
Hopefully no, it's not problematic with the testing. Hopefully we'll get more samples and also realize that there are, the providers are very much aware that commercial testing is also occurring. And so with these commercial testing, that would help to alleviate more of the testing that is being done just at public health. So I just wanted you to be aware of that.
Okay, Linda, when the commercial testing gets done, would you guys then include that in the results and reporting out?
Yes, every report is going to have to funnel through the department, whether or not it's done by the private providers through DLS, Diagnostic Laboratory Services. The report eventually has to come through DLS and, of course, public health. And so that is mandatory. Yes.
There was something that I was reading. It was one of the FEMA, I think, bulletins, and they were talking about community test facilities. Do you have any information about that?
Community test facility?
Right. I think it was a FEMA.
Mm-hmm. Well, again, community test facilities could be, the hospital. Well, here at Public Health, the Department of Public Health, it could also be DLS, which is a laboratory that can conduct the testing. So I believe that's what they mean.
Okay. Yeah, I was wondering.
Linda, are there any plans to increase the testing criteria and expand it to those who have come into contact with COVID positive patients who don't necessarily meet the limited priority categories?
There may be a possibility in the long run, but right now, as we stand, the advisory council has selected those 4 top priority groups, which I've already announced to you what they were. And right now, as we stand, things change. CDC's guidelines continue to change, and as we journey through, there is that possibility. I don't want to say no, but anything is possible at this point in time. Things keep changing. So I like to say that there's a possibility it may expand. At this point in time, however, we're looking at the priority groups.
Where are we with the not home isolation, the isolation facility in one of the hotels, and has that been stood up yet?
Yes, by tomorrow it will be open, and yes, we have already made arrangements, and we are already ready to get it up in operation by tomorrow.
Mm-hmm. And you were talking about last time we spoke about it's voluntary for the people that are in home isolation, and you guys were working to, I guess, persuade them to go into this isolation facility.
Yes.
How successful have you been, and how many people are you anticipating come tomorrow to move these home isolation patients into this isolation facility?
Yes, I can answer that question. Again, the home isolation, is those that are asymptomatic, just to, clarify. Okay. Asymptomatic or they're mild illnesses. And so they don't have to be hospitalized or they don't require any acute type of care services. And so we do say that home isolation is possible, but we have to assess the home. In other words, are there other people living in that home? And does that COVID positive patient also have their own bathroom, their own bedroom, and are they living with other people like the elderly or those that have comorbid conditions? And if so, then that would not be an ideal setting. So they would have to move to our designated government facility for the isolation. And in that regards, right now, we have about 8 ready to move tomorrow. So 3 are coming from GMH and 5 from those that are currently identified as we speak.
Linda, are the a lot of the people that you, when you go out and assess these homes, are they substandard in terms of they don't meet the criteria that you guys have for home isolation?
Yeah, it, like I said, it will be our investigators that would do this, and also our surveillance team that would go out and assess. If they are in substandard homes, then obviously we're going to have to move them. And again, they have to be isolated with their own bathroom, their own bedroom. So if some of them may be in substandard homes, if they are, then we will not allow it and we will move them.
I mean, I don't even know the right word, substandard, because like for example, my place, we don't have a separate bathroom, so
yeah,
you know, if anything
and
would
then
happen.
we assess too, you know, are you living with other people like the elderly or the comorbid conditions, with those with comorbid conditions, and if so, then that would not be an ideal setting. So those are the protocols that we have in place. So obviously, if you're not in that condition, then and you're a COVID positive person, then we will move you to the designated government facility for isolation.
I wanted to also ask you about the quarantine of passengers, the ones that are in the designated quarantine facilities. A lot of them, I believe, are scheduled to be, their quarantine would be up tomorrow. Is that correct?
That is correct, April. Yes.
Okay. And if you could kind of explain the petition that was filed?
Yes. The petition has already been filed in court, and that has already been issued. And what happens is we have to have what is called a petition for order authorizing the continued detention for isolation or quarantine, and that's when the quarantine or isolation is refused. And so this is particularly the one that was filed is for travelers arriving in Guam from Manila, the Philippines, on March 19. And so they're the respondent, and I will appear in court. I'm due to appear in court sometime this week. And what this means is that I will appear and, on behalf of the Department of Public Health, indicate that I'm authorized by Title 10, Guam Code Annotated, Chapter 3, Article 3 of Chapter 19, and as well as Article 6, to take action to protect our island. Public safety and welfare. And then this court is just to emphasize that we issued the involuntary isolation, quarantine, detaining these passengers that came from Manila because they pose a threat to the health and safety and welfare. And so I'll justify in front of the judge or the court, indicating why those are in place. And because Guam is receiving a lot of positive cases, specifically from Philippines, and Philippines is really a hot spot, meaning that a lot of the infected COVID positive patients are coming from that area, and I need to justify that. We are quarantining them for 14 days so that they don't pose a threat to our island community. And so by segregating them out in the community, this will allow us to monitor them in a least restrictive area. And so that is what I'm going to say. And of course, indicating these things because of the fact that there's also COVID indication that is occurring in the Philippines, and it has been fatal there. And then their president in the Philippines had also declared that they intended to close the airports and so forth. And moving in line with that, we have to emphasize that we too at the department are doing our surveillance and contact following up. And when we do that, we want to monitor all those households that are COVID positive and also the close contacts. And by having all these passengers continually coming into our island and being infused into our population, it makes it much more difficult, and the possibility of community transmission, and there's no containment of that infection. That is very likely if we keep having people keep coming into our island from hotspots. I hope that answers your question.
So this is just for the passengers that arrived from the Philippines on March 19th, right?
Yes, that is correct.
Okay.
That is what the directive of this proceeding, this special proceeding case, is for those travelers on the Manila Philippine flight, March 19th.
Linda, there was something that we saw nationally. I think the governor of Illinois had said that infant had passed away due to COVID-19 complications. With that news coming out, because that kind of does seem like a new development, is there any more priority being placed on the movement of the maternity ward and the neonatal ICU at the Guam Memorial Hospital because of this development?
That question I would defer to Lillian. Maybe you can ask Lillian about that. She's more in that realm to answer that question, so I don't want to say anything at this point.
I'm sorry, but I wanted to go back to the quarantine issue, and because we had received information and confirmation actually from the governor's office regarding a patient or a passenger that was at one of the quarantine facilities that was exhibiting signs and symptoms of COVID and was transported to the Guam Memorial Hospital and is listed as a PUI. Do you have any information about that? And what are you guys doing, I guess, to maybe even look into contacts over at that quarantine facility?
Yes, we're looking into that already, and as we speak, yes, we're assessing all that right now. So if anyone is identified to be COVID positive, there's that likelihood that they will be moved to this area that I indicated, the isolation government facility. And again, we're going to assess that situation.
Linda, have any children been tested for COVID-19 on Guam?
As far as we're concerned, I don't have any figures as far as that is concerned. I'm still showing 0 as far as any COVID positive cases. So again, I'll get specifics as far as if anyone was actually tested. But if they were tested, it would have been a negative at this point because there's no data to show that there is a positive test. But I'll look into that to verify.
Back to quarantine. Sorry, March 19th. How many passengers are we talking?
Okay. Right now, the involuntary, as we speak, we're looking at. I have it right in front of me. Close to about 49, but that number has dropped a bit because some of them changed their mind. So we're looking at anywhere less than 49 passengers.
Okay.
That is involuntary.
Okay. All right.
Okay, Linda. So you said again we have 300 some. What was it? 325 tests.
We have right now, as we speak. I'm gonna give you the data on that.
Okay.
348 tests remaining. Yeah.
And
we're expecting one. We're expecting a test kit delivery sometime this week.
And that's the
yeah,
box.
I don't know how many are coming because we always ask for 4 boxes, but we only get 1. So hopefully we'll see when we get it.
And how much is in a box?
Usually because it ranges, right? In the first time that we had the box, it's about close to about 400, but we had to use some of that to calibrate, revalidate the test kit. So we use some of that. So we were saying on the average about, just to be safe, anywhere between 200 to 400. So at this point in time, with the other kits coming in, that this is the second box we're opening, we're looking at about 300 to 400. And so that's where it's at right now, about that amount.
Is there also any new update on last time we spoke you were mentioning how you guys were working on emergency SNAP benefits, I believe, to prepare for the surge of people that have been impacted financially?
Yeah, right now my staff are looking into that as far as we're concerned. I know for sure that the SNAP benefits have remained that they can extend for 6 months. They're still in discussion with that, especially with the Medicaid, other than the SNAP. But going back to the SNAP, we're looking into that right now in terms of the employment, and we'll get back to you because that's still under discussion with my staff and FNS, the Food Nutrition Services.
Yeah, because you would think that you guys would be bracing yourself for a flood of people that would want to come in and apply.
Right. Yeah.
Right.
Where are we with that program with the federal emergency declaration, right? So I know that the governor said we're going to have all these different programs available. Is one of those programs emergency food stamps for people who don't normally qualify for for food stamps or SNAP benefits?
Yeah, that's the one that I think Sabrina was alluding to. We're looking into that right now, and again, there's some questions that have to be answered. So we'll get back to you on that. Usually, when we get the answer, we'll shoot out information that will go to the JIC, and then the JIC will funnel it out to the community.
Okay, I think that's about it. But just going back to the military thing, so I know that earlier you had said that they were obligated to report it to you, any cases to you as the chief public health officer of Guam, but are you now saying that they aren't obligated, they don't have to report it to you, or what?
Well, right now, as we speak, it's not to the chief public health officer, it's to the territory epidemiologist. Okay. That's where they report it to. So far, we have good contact with the military. Their personnel communicates with our territory epidemiologist in regards to the naval hospital. Now, again, the Theodore is a separate entity in terms of what is being reported. So again, I don't have any information that I can share regarding the Theodore.
So, Linda,
but
I'm getting what you're saying is basically that because if they have positive cases at Naval Hospital, then they're obligated to kind of report it. But since the Theodore Roosevelt is in a gray area, because it's a ship that's docked here, you don't know if it necessarily falls under that category where they have to. I see.
At this point in time, that's where I'm going to tell you. I only have 2 from Naval Hospital. Okay?
Okay. Thank you for clarifying that, because a lot of people are out here.
Well, they medevacked 4 to Naval Hospital. And in the press release from the Joint Information Center, when this was all starting to come out, it specified that X amount were from the USS Theodore Roosevelt. So that's why we're just asking for clarification. Right. So now we're not going to be getting that information.
Linda?
Yeah,
hello?
so the only thing that we've gotten are the 2, the only thing we've gotten are the 2 cases as I reported through the military naval hospital, because they are community members. So that has already been given to us at public health. So that's all I can tell you at this point in time.
What do you think, though? I mean, do those cases from the Theodore Roosevelt, should they count as cases on Guam? Because, aren't they on Guam?
You're asking me this question, and I'm going to tell you that the military is the best place to answer, this type of question, especially in dealing with this particular grayish area. Okay?
All right. Thank you so much, Linda.
Thanks, Linda.
All right. Thank you, too.
Okay.
All right.
Anyway.
Okay.
Well, yeah. That was Linda DeNorsi, Department of Public Health and Social Services, containing COVID. So a lot of information there. I just wanted to hammer down that military thing. I'm not sure what is up with the government of Guam running blocking for the United States military on our island. It's kind of crazy. But yeah, you're right. There was a 180. They came out and we did get information on these Roosevelt cases. And now the Navy has said we're not going to put out any more information because of operational security. And it seems like our governor, our elected governor, and our public health director are in lockstep with the military on this.
Or they're not telling her anything, but
or they're not telling. I mean, both options are not
Or telling the territorial epidemiologist.
So there you go. 7:29. Let's take a break. We'll do news. Sergeant Paul DePauza coming up on the show. An increase in crime after 2 weeks of island lockdown. Maybe. We're going to talk to Sergeant DePauza and find out. But I know that the people are starting to WhatsApp me. I just got a WhatsApp EPAN, broad daylight, yesterday, 1 o'clock in the afternoon. Saki alert. Guy sent me a little snapshot of someone sneaking into his backyard. So people are knowing that some people are staying home all day. Some are going to work. So, yeah, you guys, be extra vigilant, and we'll get Sergeant Tapau to come on and talk about that. But let's do news now containing COVID on I-94. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
It's our daddy, Specialist Joshua Mancinotnia. I can't wait for him to come home. Keep us safe and stay home.
I miss my daddy, and I can't wait to see him. So keep us safe and stay home. Dab.
During a typical disaster, the Small Business Administration would send a team out to assist the local office process applications. But the coronavirus crisis is not typical, says Guam branch manager Ken Lujan, and businesses are encouraged to apply online at www.disasterloan.sba.gov/ELA. He urges patience, though, because the website has been swamped with applications.
Keep in mind that 50 states plus the territories are actually applying for this loan. We received word on Monday, but last week, Friday, California alone had submitted 700,000 applications in our website in one time. So imagine, the amount of work Guam's going to put in and the patience we're asking them to have as they start to migrate into that website.
He says a variety of assistance is available, and the SBA can help find programs to fill long-term and immediate needs.
Basically, we can give out loans up to $2 million with a term rate of long-term maturity of 30 years, whereas the Express Bridge loan program is actually limited up to 7 years. Financing would be subject to the bank's rates, and then at the same time, too, it's limited just to working capital as well.
However, Lujan says businesses with existing loans won't be able to refinance.
So these are going to be operational debts like paying rent, paying payroll, paying utilities, things of that nature that would have been incurred during the time that the virus had taken place.
For Guam's News Network, I'm Nestor Lecanto.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
This is Tomas Maglonia on the island of Saipan, reminding you to stay home as much as possible. And when you have to leave your home for essential things, practice social distancing. Remember, you can still keep in touch with your loved ones online. We can get through this as one archipelago, one Marianas.
Buenas and half a day. Mabuhay. What's up, Guam? I'm Norm. If you're watching this from home, then great. But if you're somewhere you don't have to absolutely be, please go home and stay there. I know it's difficult for us to change our routines and habits, and personally, I'd rather be with my family and friends dining in a restaurant or going to the movies. But the timing, it's just not right. We're asked to make a little sacrifice now, but in the long run, it'll help to ensure that you and your loved ones remain safe. We're dealing with an unprecedented health crisis, and we need everyone's cooperation. Let's fight the spread of the coronavirus by doing our part to stay home so that Guam can stay safe.
During our morning radio show containing COVID, Governor Lou Leon Guerrero says that discussions are underway to prepare for a spike in COVID-19 cases. The goal is to increase our capacity to at least 2,000 hospital beds.
We're looking at even bringing in Blue Med plants. We're looking at Army Corps of Engineers offering this conversion from a facility to a hospital facility. We're also looking at bringing in a barge. There's been an offer to bring in a barge that can be hospital retrofitted.
Tasked with working with the Army Corps of Engineers is National Guard Adjutant General Esther Agagi. She is reaching out to the island's medical community to complete a report that will be submitted to the governor. Wasn't me. I don't think we made her mad.
No, I think she's just frustrated. I know Linda. She's a good lady. She's very, very intelligent. She's done a lot of great things for public health on Guam, and my read on it, I think she's frustrated. Let's let this breathe a little bit. The last day of Mes Chamorro, but you know what? Mes Chamorro is never over because it is Anya Chamorro this year. Okay.
Anya Chamorro. Is it the 31st?
Yeah, it is the 31st.
Oh, okay.
Let's go over to that. And we're going to be talking about this whole development with Linda saying that. So basically, what she is saying is that because they're being tested on the Theodore Roosevelt, technically, it's not run through Naval Hospital, then we don't get the results. But
I just don't buy that, because on the 26th of March, this is one of the Joint Information Center press releases. They clearly separated and announced how many positive cases from the USS Theodore Roosevelt, and at that time it was 4. Now we can't get definitive confirmation, but it's over 30.
I saw something national media saying it's over 40 now.
Over 40 now.
Yeah, I'll send you the link as in the.
And then you saw also the 2 supposedly confirmed from the USS Ronald Reagan, and that's in Yokosuka, Japan.
Right. But you know what's frustrating to me is that this passing the buck, the governor telling everybody that she talks to the admirals, daily. She's talking to this admiral. She's talking to that admiral. What good is that doing us, though? And for them to defer the questions to the admiral, first of all, have you ever tried asking the military a question? I mean, you got to email like 8 different people during an eclipse on a Tuesday, and then travel back in time and, bounce your toes, jump, do a backflip and then you won't get an answer. So to me, it's very frustrating that they are just deferring all this stuff to the military. I mean, who are you serving? Are you serving the people of Guam, or are you serving the Department of Defense? It's as simple as that. Let's get Tomas Maglotnia on the line here, Bree from Saipan. Good morning, Tomas.
That's music. Hafide, Tomas.
There you are.
Hi, Chris and Bree.
Okay, what's the latest over there?
Here's the latest on containing COVID-19 in the Northern Mariana Islands. Some tragic news overnight. One suspected COVID-19 related death of a 70-year-old man announced yesterday evening by the CNMI governor and the COVID-19 task force. The specimen of the deceased individual suspected to be related to COVID-19 was sent to Guam's public health lab as high priority, according to hospital CEO Esther Muña. The patient, a CNMI resident, and his wife were quarantined at Kanoa Hotel after seeking help at the Commonwealth Healthcare Corporation on March 25th after exhibiting symptoms in line with CDC's guidelines. The individual has multiple underlying medical conditions, and after being offered treatment, next of kin opted for more comfort care at the hospital. They opted for more comfort care at the hotel. Muña says that the individual has no travel history but had contact with someone who tested positive for COVID-19. She says the case is related to the 2 confirmed cases of coronavirus patients in the CNMI that was announced over the weekend. Governor Torres also handing down new strict directives after expressing sympathy for the family. A new curfew from 7 p.m. to 6 a.m. is applied to all residents of all ages. That took effect last night. According to a release sent by CNMI Governor's Press Secretary Kevin Bautista, quote, only exceptions will include adults who are first responders, medical workers, law enforcement officers, and private sector employees on duty within the curfew hours, and minors who are accompanied by their parent, guardian, or an adult, who are in the direct route of driving and returning home, or who are lawfully employed during the hours specified, end quote. The CNMI, we learned last night, has sent 20 specimens to Guam, and 11 results are pending. They expect to test at least 8 more individuals today, some with relation to the first confirmed cases. Task Force Chair Warren Villagomez assured the public that the designated facilities are being monitored. CHC medical doctor Beth Conan was not able to disclose the symptoms of the deceased individual. She emphasized that those with underlying conditions are at generally greater risk. Dr. Conan assured the public that while quarantine travelers and isolated cases are in the same facility, there is 24-hour monitoring, and those within Kanoa Hotel are separated by various floors in different rooms. Strict safety precautions are also taking place at CHC. The phrase echoed through the press conference and through this region: residents need to stay home. That's the latest as of yesterday on containing COVID-19 in the NMI.
There was something during the press conference you had asked actually about this possible connection between the positive COVID patient and the suspected COVID death, right? Didn't you ask something about that during the press conference?
Yes, and so it wasn't clear at first whether or not the suspected COVID-19 related death was related, and when we clarified with Esther Muña, she did confirm that yes, there was contact with one of the cases or both. It wasn't clear, but that they are not able to disclose the relationship I know later on in that press conference, and you shared it at the top of the radio show, Bree, you asked about whether it happened, whether contact happened at CHC or at a faith-based organization that they referenced on Saturday. They made clear it wasn't at the hospital, but couldn't further clarify the environment that this might have happened in.
You know, I was thinking, I wonder if they had walked into the hospital together. You know what I mean? If like maybe they were, I don't even want to speculate. I mean, they could have been family. I don't know.
Tomas, I don't know if you heard Linda earlier, but apparently there was a problem with the swab from the deceased suspected COVID-19 patient, and Saipan has sent another swab that she says they're anticipating on running today.
Yes, I did heard that. That is news to me, and probably news to some folks who are just tuning in now. That she did confirm that. I think I also wanted to share that Governor Torres was definitely emphasizing that he is in constant communication with the Magahaga in Guam to ensure that priority testing is done for the CNMI. That's something he reiterated a few times last night after the press conference.
Well, did you also hear that Linda said that? I feel like I'm like, hey, did you hear what Linda said? Did you hear what Linda said about CNMI? Well, no, she said that they're going to dedicate about 5 of our normal test runs. So 5 tests will be dedicated to Saipan. So I don't know how many samples. You guys have sent 11 pending. I'm not sure if we're going to bang out 5 today, 5 tomorrow, but that's where we are at. I guess that's the level of priority the samples from Saipan are being given.
Yes, Chris, and again, the information that we were given yesterday at the press conference is that 11 results are pending, and they expect to at least test 8 more individuals today, some not necessarily related to the confirmed cases, as the CEO clarified yesterday. And, lots of new restrictions are in place, lots of new regulations. One of the biggest things that came out of the Commonwealth Health Center late last night was that they've modified their expectant mothers process. So in terms of the birthing, any new births and labors here in the CNMI, it says here in their latest release that the hospital will allow expectant mothers to identify a birthing partner who can be present in the delivery room with her during labor. However, after the baby is born, the identified partner will be allowed a moment of physical contact with the newborn and will need to exit the labor and delivery area immediately. So there's lots of different mechanisms now in place that are in response to this suspected COVID-19 related death here in the CNMI.
No, I'm not going to say anything.
Just say it, Bree. Come on.
No. It just seemed like Dr. Beth kind of got upset with me.
Yeah,
I don't know.
I gotta say that,
or it was just that she's under so much stress.
Right.
Kind of felt bad for her.
Yeah, she kind of got yelled at. I don't know if you guys saw this NMI.
Where of the contact tracing, the villages that the residents may have resided in. Of course, as mentioned previously, there is that balance between community safety and the privacy of the patient. And there's also questions, that lead to the economy and how the government is being able to pay for the quarantine facilities amid this pandemic, and also with results to some possible cut in pay for some members of the community and support that they might be able to avail to. So, we hope to ask questions about the economy much later in the process once all these different cases continue to shuffle in, and we also hope to keep everyone informed as they do, and hope to hear more from the COVID-19 task force.
Okay. Thank you, Tomas.
Thanks, Tomas.
We're looking forward to hearing from you later on.
Thanks, Chris and Bree. Have a good day.
You too.
Right. I got a comment here, and I just wanted to share. Someone had commented that Naval Base Guam, the Joint Region Marianas, would be a good place to start seeking information. And we've reported on this, but our Nestor Lecanto did send questions over to Joint Region Marianas,
and has been
one of the questions we sent. Can you confirm the number of sailors who are currently under isolation for COVID-19 symptoms? National media reports there are at least at this time 23 positive cases. Is that accurate? The answer from Joint Region Marianas: to protect operational security, we are not disclosing any specific numbers of sailors with test results indicative of COVID-19. So that's why I guess they haven't been reporting those numbers. Okay. Let's take a break. 7:51. Sergeant Paul Tapau is going to be on the phone here talking about what you can do to watch your back here, as people I think are getting arrested. We had an incident right here it was crazy, man, right around the corner here where someone had went under a van, cut the gas line, and stole all the gas out of the van. It's just like, what? So, people it's the devil's workshop, that idle hands thing. We'll talk to Sergeant Tapau. Next is 751, containing COVID. Good morning.
Dave Delgado here for KUAM Sports. Thanks for watching tonight on the show. We're going to hear from UOG Athletic Director Doug Palmer. What's next for student athletes, classes, scholarships, and leagues? Check it out.
Pretty much we just tell them to stay in contact with the university's website and the information, that's there, and the public information that's from the actual offices of Gov Guam, and just don't follow a lot of the rumors and stuff that are out there. Go to official sites, but try to use the university as much as possible.
All University of Guam varsity and club sports are suspended until the fall semester. Guam and the university's move to online-only classes for the remainder of the semester were announced March 19th through a press release.
Yeah, no, the kids get to keep their scholarships. Actually, if they haven't used all their money yet, I told them to, get me in any other names that you have that we want to give a scholarship to for this past semester, what we were able to play. So, because the money that we do get for scholarships, we don't get to keep it for the next year. We have to get rid of it or it's swept. So we're going to try to spend every dollar that we have to the students. And so hopefully a few of the students will be getting some $500 type checks sometime soon to help them at the end of the semester.
The Triton women's basketball team will return to play on September 8th. The Trident women's club volleyball team is scheduled to start October 6th. The Triton men's basketball team will return to play on October 27th. Men's and women's soccer will return for play in the fall in the Guam Football Association leagues, yet to be determined, along with the newly reinstated men's baseball team, also a possibility for fall pending player recruitment.
I told the coaches to continue to recruit as best they can, mostly by, of course, telephone, social media, email, contact the high schools and try to get coaches' numbers and things, since we no longer have games to go see and play. So, and we're not sure when we'll be able to have tryouts. We may not be able to have tryouts until the fall comes. So we need to try to recruit as best we can. And most of the coaches are pretty much into basketball or soccer on the island. So they know the students that are recruitable. So we will start trying to recruit them and hopefully get, some recruiting classes.
For more information, contact Doug Palmer, Athletics Director for University of Guam at 735-2862 or email palmerd@triton.uog.edu.
Alpha Day Guam, this is Rocky Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So And I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please stay at home and stop the spread of the virus. Thank you.
Miss our daddy, Specialist Joshua Mancinotnia. I can't wait for him to come home. Keep us safe and stay home.
I miss my daddy, and I can't wait to see him. So keep us safe and stay home. Dab.
GU Self Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
During a typical disaster, the Small Business Administration would send a team out to assist the local office process applications. But the coronavirus crisis is not typical, says Guam Branch Manager Ken Lujan, and businesses are encouraged to apply online at www.disasterloan.sba.gov/ELA. He urges patience, though, because the website has been swamped with applications.
Keep in mind that 50 states plus the territories are actually applying for this loan. We received word on Monday, but last week, Friday, California alone had submitted 700,000 applications in our website in one time. So imagine, the amount of work Guam's going to put in and the patience we're asking them to have as they start to migrate into that website.
He says a variety of assistance is available, and the SBA can help find programs to fill long-term and immediate needs.
Basically, we can give out loans up to $2 million with a term rate of long-term maturity of 30 years, whereas the Express Bridge loan program is actually limited up to 7 years. Financing would be subject to the bank's rates, and then at the same time, too, it's limited just to working capital as well.
However, Lujan says businesses with existing loans won't be able to refinance.
So these are going to be operational debts like paying rent, paying payroll, paying utilities, things of that nature that would have been.
We're KUAM-FM, Agotni, Guam. A little bit of loyal migrants. Let's get right to it and check out one of Guam's finest.
How you doing, Paul?
Hey, Hafaday. Good morning, and hope everybody's staying safe.
Sergeant Paul Tapao, the Guam Police Department. Sarge, we wanted to bring you on. Where are we at with crime? Because I don't know if this is anecdotal, but it does seem like the bad guys are starting to pop their heads out.
Well, other than what we've been reporting to the media, and of course what you're seeing in the Magic's report, every media outlet has the ability to obtain the magistrate's reports. But if you're really tracking what we've actually been highlighting, it's a really dynamic effect prior to COVID-19, and of course where we are now with the onset of COVID-19. Many different changes in which the Guam Police Department has undergone with addressing and of course moving forward with COVID-19. So we still have our standard patrol officers that are out there investigating crime, or providing the omnipresence and preventing crime from happening. Of course, with the governor's executive order for the mandatory isolation, and of course the suspension of various operations to include government buildings and of course private. We've seen some reports of home break-ins and of course break-ins to business establishments. One of the reports that I'm actually working on is a break-in that happened at the Chamorro village. There's the shops along there actually reported yesterday, or I stand correct, last night, a slew of break-ins that happened to their establishment. So we're going to be working on that release. But the opportunity presents itself for everybody, both the criminals and of course our law-abiding citizens, in really making the choices in helping better our island by being vigilant out there, by providing information to suspicious activities. We're seeing an uptick in a lot of reports coming in from our neighborhood watch programs that have actually helped us with curfew enforcement. And the numbers that we're tracking from last week, or since the onset of COVID-19, we're seeing a decrease with violators that are offending with the curfew, because what we've done is we've actually reached out to our neighborhood watch groups, and we had asked them to please actively report any curfew violations. So we're going to be working closely with them. Yesterday was a great, I don't want to say a great tool that we use in reference to what was shared in the social media relative to the active shooter. With the components of the neighborhood watch groups, we have a neighborhood watch commanders chat in which we actually vet information that comes in, whether it be information from social media or any inquiries about crime related or issues with safety and security. So with the incident that happened in East Gajanero, the reports of active shooter happening in Jigo, we were able to vet that and of course provide the information to assure the safety of the community, and of course to avoid prevent any panic within that respective community in Jigo. But we saw the effects of what social media does with our watch groups down in Malolo, our watch groups in Santa Rita and Nagin, and of course our central area. So this is a great opportunity in which we can actually develop and of course find methods in which we can actually utilize and start utilizing our neighborhood watch program. But we're starting to see reports of break-ins to business establishments that have been closed because of the isolation and of course the closure or the suspension of government and private operations. So as our officers are out and about, we're really reaching out to our neighborhood watch groups to be the eyes and ears for the community and report any suspicious activity. So this is where we are now with in reference to what's going on with crime related with the onset of COVID-19.
Sarge, are you guys at all hampered in your response capability, given I know you guys aren't shut down, but social distancing or just, how has this whole COVID-19 affected you guys' ability to respond to these calls?
It changed. It changed like every other agency and jurisdictions that deals with law enforcement. It really changes the mindset. That's the first thing that we needed to practice, was changing the officer's mindset. We've limited the contact with the community by isolating people from coming into the precincts. We have in ways in which we actually respond to calls, we have to ask the precursor questions so that the supervisors can deploy the personnel accordingly should somebody be affected with COVID-19. Our officers have to practice social distancing, whether we get up close and personal. The mindset in itself has shifted, and more of social distancing and maintaining the safety of the individual officer. But nonetheless, we still have active patrol officers. That didn't change anything with the numbers of what we're putting out there. We've deployed officers to the skilled nursing facility. We have a response team. We have a curfew a curfew task force team that's out there. We work closely with the Department of Youth Affairs and that. But we're seeing more officers, more presence and out and about in the streets. So the operations in itself with patrol, the foundation and the backbone of every police agency, is met and is providing the same service as it has been prior to COVID-19. With the introduction of COVID-19, we've shifted operations in providing security personnel at the quarantine sites, and of course our task force. So, the Guam Police Department has ramped up a lot of what we needed to do to in moving and addressing with COVID-19.
Paul, I wanted to ask about, I know that you guys have the curfew law in place, but you're starting to see some of these knuckleheads that are out there committing serious crimes. These aren't just like, I'm out past curfew and I'm hanging out with my friends. They're actually breaking into places. There's reports of home invasion, aggravated assault. How concerned should the community be?
It's really an issue in which we're trying to work with the parents, and the community has every right to be concerned. The community has every right to be frustrated because I know firsthand every individual is doing their part in assuring the safety of not just themselves, but the entire community, and adhering to the executive order of staying home and isolating people and everything. But you're right, we have knuckleheads who just don't understand, and maybe it's just ignorance of the fact of what's going on and what's happening. They still believe it's a liberty, it's a holiday and everything. So the onus is really on the parents and how we convey the message to the parents. You got to applaud, and I like to really applaud our juvenile task force who are working closely with the Department of Youth Affairs. They are really providing the educational platform about the importance of the curfew. And we're providing the numbers, as you saw, last week, which we provided to the Joint Information Center. The numbers have actually gone down within the past few days, and I think the message is finally reaching home to a lot of these offenders or these minors who choose to violate the curfew. But you're right, it is concerning. The community has every right to be concerned and frustrated, and this is where we've actually seen a uptick in information provided by the neighborhood watch groups. We've actually placed some of the task force members with the curfew violator or the curfew task force within the respective watch groups. So it's just a matter of a drop of a dime when somebody reports a curfew violator that our task force, will respond in a proper timely manner. And this is, it's alarming to see some of the videos that are circulating where we know for a fact they're minors. They're actually donning PPEs. They have gloves, masks, and they're trying to break into cars. And like, okay, you're practicing personal protection, safety, but you're also committing a serious crime. So, when we do make the apprehensions, there's an understanding that these offenders or these violators are going to have to face the consequences, and this is why we're mandating the confinement at the Department of Youth Affairs. But we're working to address this. We understand the seriousness, and we've had issues with alcohol related, and this is where we need to work with the
alcohol related.
Yeah.
How? Okay.
Yeah,
where are they getting the alcohol?
When we used to have our daily function about when people ask where they get the alcohol, we used to attribute it to the Magic Bus Stop. But now there's no Magic Bus Stop because there's no school operation. It's really where they can get their hands on alcohol, whether it be somebody who provides it to them, an adult, an irresponsible adult who provides it to the minors. This is where they have to understand that, hey, if you keep these kids out of harm's way, if you don't provide this, if you don't influence these kids in this negative way, you can actually help not just the family or the household member, but you're actually helping the community because they're tying down their resources. Realistically, if our officers have to respond to a drunken minor, and they, a riot ensues, God forbid a full escalated riot ensues. This is why we have to be proactive out there as a community and report this once they spot a curfew violator, because we don't want it to escalate any further than where we know it can escalate.
Yeah, I mean, because you have people already scared of the coronavirus, and now we got to be scared of these knuckleheads running around the streets.
There should be some kind of added like vulnerable victims. I wonder if we could apply vulnerable victim to anybody who's obeying this shutdown.
Yeah, this is where, Chris, that's really something which we would like to work with the AGs. We've been working closely with the AGs in how we do our arrests, and getting the guidance with the prosecutors and how they're going to move forward. So we work closely with the AGs, and we've been working. Basil has been attached to a lot of the officers' hips, in reference to how we move forward with the cases and how we can actually help the vulnerable victims in this aspect. But every day presents a new challenge, and every day presents a new opportunity in exploring these challenges and how we address it and how we tackle it. So like I said, life changed for Guam yesterday, so, and it continues to change. So as it evolves, we'll move forward and address it.
So I guess you would recommend, if you're not on your village neighborhood watch chat group, get on it today.
Get on it. It's paying its saying it's twofold. It's back to the community, and we're seeing a lot of information sharing, COVID related, and we're also seeing a lot of information sharing about safety and security within the community. So, a lot of these area commanders within the respective groups have actually stepped up, and have actually ramped up, a lot of the information sharing and then that's really important. Is the processing of information and how they get it, vetting it to the Guam Police Department. We're able to vet it to the Marianas Fusion Center. We're able to vet these informations to the Joint Information Center, and of course the Guam Police Department and all the other agencies. So, if you want straight information coming from the source, get involved with a neighborhood watch group. If you want information about what's going on in your community and how you can help safeguard your community, get involved with your neighborhood watch group. It doesn't take, we're not asking you to go out there and be, vigilante patrol. We're just asking you just to pay.
Are you sure we're not at that point yet, Sarge? I feel like we need to do vigilante patrol.
No, we the community has taken ownership, and just understanding. And when we did the training, just prying out of your eye, your windows and your doors at home. You can actually, you're providing the surveillance for the community. So we're seeing a lot of great reports coming in from the community watch groups. So, get involved there. And that's where we can actually help safeguard and, allow our officers and all our first responders to respond to serious, calls. Serious calls that we require are the man hours and, of course, the personnel. So if we can prevent this from happening, if we can be all proactive, we can see, a better turn in direction of where crime is now within the community. But nonetheless, we're still moving forward with the Guam Police Department, and we're still working alongside our respective neighborhood watch groups and, of course, our respective mayors.
All right.
Well, Sarge, I want to thank you for your time, and we'll be sure to get the message out to stay home. You guys just stay home. You won't be doing home invasion and all that stuff.
That's classic. I really admire you guys as PSAs. It hits home, and understanding the importance of the executive order. We can actually, if you're tracking the numbers and stuff, it's really, people just do their part. People just do their, understand their personal responsibility by staying home, by practicing proper hygiene, and of course, educating your kids about what they need to do. This changed for everything. I had to talk to my kids about, in the event of this situation happening, this is what you need to do. And that's hard, talking to a 12 and a 17-year-old that, should we come to this is what needs to be done. I never thought I'd be talking to my kids like that. And, we've come to grips of where we are. And I, like I said, information is the key right now and what we need to do to move forward with COVID and how we can actually work as a community. So pay attention to the information coming out of the Joint Information Center. Get involved with your neighborhood watch group, and like your PSAs, stay home and exercise your personal responsibility and your community responsibility by practicing what you need to do, and just stay home and just write it out like everybody else.
You're not saying it right, Sarge. You got to be like, just stay home.
Wait, before you say it that way, I wanted to ask, in the CNMI, they implemented a mandatory 7 p.m. curfew for everybody, not just the kids. Do you foresee that at some point going into effect here?
That's a tough decision that has to be made by the agency heads, and of course, alongside with our leaders here. And like I said, we have to take this day by day, and the decision is really the direction that we're, from the governor. She's really provided us with good leadership and a good direction of what we need to do in addressing with COVID-19. And my heart goes out to my 670 peeps up at Saipan and of course the Northern Marianas. It was tragic. It was tragic hearing that, and Governor Torres understands. He has the authority to do that, and where we are now with Guam, again, we have to wait for the guidance and the leadership of the governor and the lieutenant
right,
governor.
but decisions are made based on guidance is provided to her, and so you would think that that guidance would come from the police department, the men and women that are out there out in the field battling these knuckleheads that are out there running amok.
I think if we take a holistic approach from the community, course, good reasoning and everything. And she has good leadership within the cabinet, the advisors. Carlo Branch, and Carlo Branch is a phenomenal individual. He's a genius in my mindset, and with the agencies and of course the cabinet leaders, can lead the governor making and providing the information that should be warranted.
All right, thanks, Paul. Can you just go ahead and do your stay home?
All right, stay home, everybody.
No, a little bit louder, more emphasis.
Like bad.
To the knuckleheads out there.
Chris did it better than me. So, I'm practicing good feng shui in my house and in my office. And,
He's doing his breathing right now, Bree. Don't mess up his focus.
Yeah, but I got my calming methods. So,
right. Yeah.
Me too.
Patchouli oil. I don't think your calming method is working, Sabrina. Thank you, Sarge.
Be safe, stay healthy.
Okay. Okay, that's that. Okay. There you go, Sergeant Paul Tapau. You know what is interesting, Bree, what I was thinking about yesterday, driving around, picking up lunch, so much traffic, and it just makes me mad. It makes me mad because we're accepted. We're in the media. We have, authority. We can be here. We can do our job. But going out there, man, you guys are just not taking this serious. I mean, a line like 40 cars to get coffee? Are you serious, guys? Come on. It just annoys the hell out of me, Bria.
Jason?
Okay, I just want to add something. The three of us have had this discussion privately. Now I'd like to open it up a little more.
Yeah.
Do you guys foresee us going into a state of martial law?
That's what I was going to say.
And do you actually support that decision?
I'm saying a lot of people want martial law. In what world are we living in where people are welcoming the idea of us being locked down and National Guard troops, tanks in the streets? That's what the people want.
Now, I didn't get a chance to jump on with Sergeant Tapau there, but if I did, I was actually going to ask him if we do get to that point, what then does GPD's role and jurisdiction become if you've got National Guardsmen and uniformed police officers trying to make sure that everybody does in fact stay in?
Yeah, I think they just work together and do what they got to do. Just tase everybody.
So
you would out, tase them.
So you would be in favor of that?
I would vote for it twice.
There you go.
If that's what we got to do, to don't talk to Bree. She's typing hard.
Yeah.
No, but in talking to a lot of people, and you see it in the comments, everyone's like, lock down the island. They all seem to think that no one is taking this seriously. There goes 20 cars right by my window, and they're not. They're not taking it serious. There's too many exceptions. There's a mixed message. The beaches are closed, but go to the beach and do your mental exercise. So yeah, we take a break. It's 8:19. We're gonna talk a session, and
we are.
Yeah, we're gonna get
what session?
Yeah, exactly. So I got some thoughts on this. This is just well, it's a rapidly evolving situation is what it is. And we're going to find out and get to the bottom of why your elected senators haven't done any work. Can I say they haven't done any work? Or are they going to say, like, no, we called. We worked over the phone. We sent a letter. Yeah, but there's no session. And now it looks like there's not going to be session TFN until further notice. 820. It's containing COVID. Yeah,
MIA.
Okay. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
The soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
Dave Delgado here for KUAM Sports. Thanks for watching tonight on the show. We're going to hear from UOG Athletic Director Doug Palmer. What's next for student athletes, classes, scholarships, and leagues? Check it out.
Pretty much we just tell them to stay in contact with the university's website and the information, that's there, and the public information that's from the actual offices of Gov Guam, and just don't follow a lot of the rumors and stuff that are out there. Go to official sites, but try to use the university as much as possible.
All University of Guam varsity and club sports are suspended until the fall semester. Guam and the university's move to online-only classes for the remainder of the semester were announced March 19th through a press release.
Yeah, no, the kids get to keep their scholarships. Actually, if they haven't used all their money yet, I told them to, get me in any other names that you have that we want to give a scholarship to for this past semester, what we were able to play. So, because the money that we do get for scholarships, we don't get to keep it for the next year. We have to get rid of it or it's swept. So we're going to try to spend every dollar that we have to the students. And so hopefully a few of the students will be getting some $500 type checks sometime soon to help them at the end of the semester.
The Triton women's basketball team will return to play on September 8th. The Trident women's club volleyball team is scheduled to start October 6th. The Triton men's basketball team will return to play on October 27th. Men's and women's soccer will return for play in the fall in the Guam Football Association leagues, yet to be determined, along with the newly reinstated men's baseball team, also a possibility for fall pending player recruitment.
I told the coaches to continue to recruit as best they can, mostly by, of course, telephone, social media, email, contact the high schools and try to get coaches' numbers and things, since we no longer have games to go see and play. So, and we're not sure when we'll be able to have tryouts. We may not be able to have tryouts until the fall comes. So we need to try to recruit as best we can. And most of the coaches are pretty much into basketball or soccer on the island, so they know the students that are recruitable. So we will start trying to recruit them and hopefully get some recruiting classes.
For more information, contact Doug Palmer, Athletics Director for University of Guam at 735-2862 or email palmerd@triton.uog.edu.
Guam entertained during this mandatory social isolation quarantine thing. John Dank Show. Primo John. Easy for you to say. It's 8:25 Tuesday, 31st day of March. Of course, we had two positive COVID cases yesterday, but we're going to bring Jason on to the show here.
Hello, half a day, bro.
You want to put on the headphones so you could hear the doctor?
Oh, okay.
Yeah. And we're going to bring up Dr. Thomas Christ, the president of the University of Guam. Good morning, Doc.
Good morning. How are you both?
We're doing pretty good. And so you had something to share with our listeners and viewers this morning.
Yes, we're going to be hosting a telethon on next week on the 8th, and we'll be raising funds for the for meals for nurses and support personnel who are staffing the island's public health and call centers for the COVID-19 surveillance, and masks and gloves and face shields and whatnot. And more fun will be that there'll be some entertainment, of course, with the telethon. So we'll be raising money, but also entertaining and providing a lot of information for people on how to deal with all kinds of things that we're dealing with nowadays.
Right, and so on the entertainment end, our Jason Salas has agreed to do, I don't know if you have any jugglers.
Well, that certainly would be entertaining. I'm sure it won't be accurate, but I'm sure that would elicit a couple laughs. But Dr. Kreis, very good to talk to you again, sir. And as a proud alumni of Triton State U, as we like to call it, and everything like that, I would, if you'll permit me, sir, I would like to be the first alumni of UOG to actually make a pledge. I'm gonna donate $20, and I challenge everybody else from my class, from the class of 1996, to donate $20 so that we can take care of our healthcare workers, first line responders, and anybody out there who is, in no stretch of the imagination, really risking their lives to do the work that they have to do to make sure that our community can fight this thing. So I'm committing $20, and I challenge everybody from class of 96 to please do the same.
That's terrific. Thank you very much indeed. We'll put it to very, very good use.
Okay, and I know that the UOG Endowment Foundation, your site is up and has been up, so it's give.uog.edu. Is that correct, sir?
That's right. That's right. And
right.
Starting Thursday, we'll have a short text messaging way to give to it. Denominations of $5, $10, and $25.
Outstanding.
So starting on Thursday, so I have that available. And then we'll also have a call in if people don't want to do it in either of those two ways. They'll be able to call in starting. The numbers will be announced at the end of this week.
Okay, you know what? I'd like to broaden my challenge. Tell you what, I will up my own donation to $50. I'm donating a half a C note, right? $50 to anybody from the class of 96. Anybody from College of Business and Public Administration, where I graduated from. So all marketing majors, especially you guys, because we know you guys love to talk about money, even though it's the accountants who actually know about that kind of stuff better. So us marketing majors love to just like throw numbers around. So donate $50, everybody. I'm challenging you guys, and everybody who is majoring in any of the technology. So anybody who wants to get into computer science, nerd to nerd, I'm challenging you guys to give $50, please.
That's great. Thanks. That's terrific. And I should remark that we've got a lot of people volunteering help right now, too. So we've got people donating food and water, and we have chefs donating their cooking skills, so cooking up donated food. So TCC's chefs are joining that group, too, along with some others. So we've got a lot of effort going on. And I think many people just, the ones who are kind of cooped up with not as much to do are looking for ways to help. So we're just trying to figure out a way to offer people a chance to come together and support this effort. And particularly our frontline medical healthcare workers are really, really the heroes of this whole episode.
Okay, now, Dr. Kreis, I know when we say the word live stream these days, everybody's ears perk up and everybody says, okay, what platform are we talking about when you guys do your telethon? Are we talking about Facebook Live? Everybody in the world is all about Zoom these days, and I'm sure Zoom's stock price is through the roof. What platform will you be facilitating your telethon over? Because we're going to share it, of course, so people will be able to find us from us as well.
So it'll be Facebook Live, and it'll be on the University of Guam's main Facebook page. You'll be able to find it right there.
All right, and we're going to share it too. You can do, will do.
Great, thank you. That's
okay,
terrific.
Doc. Anything else in closing you want to add?
Just thanks to all the people that are putting this together, and we'll have really great tips on things like everything from gardening to mental health care to other ways that people can help. So there'll be some entertainment, there'll be music, there'll be all kinds of great things from the University of Guam community. The whole Triton community will be contributing to this, and so we look forward to partners and alums and everybody across the island to help out. So.
All right. Thank you, Doc, and we'll be glad to. And again, Jason, you want to do that call out? You donated $50, and you're challenging who?
Yes, so $50. I'm committing $50. Dr. Kreis was nice enough to let me be the first quasi, pledger, and so I'm challenging anybody else from my class of 1996. That's when I graduated from UOG. Very proud to say so. So anybody from class of 96, anybody that went to CPBA, so any business majors or public admin majors, and anybody majoring in computer science, give what you can. I mean, you don't have to match $50. I hope that you would. I mean, Lord, we graduated, 24 years ago. I hope at this point, you'd be stable. But, it is very, very trying times. So please make some sort of contribution. So I'm challenging anybody from class of 96, CPBA, and any computer science majors. Thank you, thank you, thank you from all of us that graduated from UOG, and we're very happy to help our alma mater.
All right. Thank you, Doc.
Jason. That's great.
And sorry, Jason called you a nerd.
Too. Yeah, that's great.
Okay.
Look forward to seeing you next week on the 8th.
Okay, Doc. Appreciate it, man, and thank you for your efforts.
Yeah, thank you.
Okay, you got it. He's like, that's a compliment coming from Jason.
I wasn't calling him a nerd. I was calling all the computer science majors nerds.
Oh, I thought you were saying nerd to nerd, Doc.
No, Hey, I've done a couple crazy things in my career here at KUM. Calling the guy who could possibly revoke my diploma is something I would never do. He has that power now.
So let the record show that that we're going to strike that from the record.
He could just go into maybe like one of my student records from 1996 and say, why don't we just change that grade from pass to fail?
If he could do that, he's probably a nerd. Okay, if he can hack into all that stuff.
That's a good point.
That's all right. Okay. Thanks, Jason Salas from the KUM news team. Let's get Sabrina in here. We're going to talk about session, but first, for those of you guys just joining us, we do this latest release that came out from the Joint Information Center. Since we're only doing one batch of testing lately, we got the results kind of early.
What are we talking about?
Yesterday?
Yeah, the results. Yeah, we got 20 tests, I believe, were ran. 2 came back positive for COVID-19 on Guam, which brings the total number to 58.
Right, and so in talking to Linda DeNorsi this morning, she had told us we have 348 tests and that we're all caught up. So apparently people are not getting swabbed out there. I want to talk to some doctors at the clinics.
Was that within the limited group, or was that everybody? I was
so
still kind of like
she said we have
that.
348 test kits left. That's that box. That,
right, and then we're getting more.
And the limited priority testing, I guess, is still ongoing. And so is there a backlog? It depends on who you ask.
Right.
Let's jump to session real quick. So we're going to play this clip from the governor here.
Right, this was during the press briefing that she has daily at 1 o'clock in the afternoon, and the question was asked by Nestor Lecanto on what if she had any thoughts on the legislature going into emergency session, which was supposed to happen today.
Good afternoon, Governor. As you know, the legislature will meet tomorrow. This will be the first time they're gathering in session since this whole crisis started, and as we understand, there's going to be a whole slew of bills that will be geared towards addressing the coronavirus crisis, everything from raising the ceiling on the Dave Santos Act, waiving, I guess, the set aside for the rainy day fund, rolling back the BPT, rolling back the liquid fuel tax possibly, and possibly even overriding your veto of the $1 million transfer authority. What can you comment on session tomorrow?
Yes, I don't exactly know what their agenda is tomorrow, but of course, the senators are elected officials and they have constituents that they have to respond to, and they're all just as concerned as you and I and everyone else about the status of this coronavirus. They're wanting to make sure that the public is given enough financial help. They're wanting to make sure that I am also provided with the policies and the resources that I would need in order for us to battle this viral nightmare. And so, that's within their purview. They can hold their session anytime they want to. That's their authority. And if those policies that they are going to be looking at and passing is going to benefit more in terms of helping our people, I would look at that very closely. But I just want to also inform you that most of the ones that they're looking at is to provide direct cash to our people. And we are already doing that from an executive level through the federal government and the White House and the other and Congress. So they are pouring in, a lot of financial help for not just individuals, but for businesses, for the hospital. They're pouring in a lot of that for us and also the 50 states of the United States, because everyone is suffering from this virus. They're suffering economically, they're suffering financially, they're suffering with their lives, most importantly. They're suffering from anxiety, they're suffering from, staying at home. Our whole life is being changed by this virus. So whatever the senators can do to help, that would be much, I think, appreciated from us. But I need to also weigh out what does that mean in terms of our recovery? What does that mean in terms of future sources and revenues so we can continue providing public safety, health, and education?
All right. And so watching this, Sabrina, seeing this come out, I think it was pretty clear that the governor wanted this to be a one-woman show. And so this came out, and then a few hours later,
around just before around 8:30 last night.
And it's funny because I had called the speaker's office and I said, "Hey, let's get the speaker on tomorrow because you guys are gonna have session, and it'd be good to find out, what are you guys working on? Because it seems like they had a lot of important bills to address." And the comment I got was like, "Oh yeah, she's not gonna call because we're gonna release a session update in a little bit." And then the release came out, and the speaker. William Barnes, do you have that letter?
Oh, yeah, I do. First, the governor had actually written the speaker, and this is what led to the postponement. And the governor wrote that she's appreciative to the legislature, their willingness to address growing concerns because of the spread of COVID-19. However, she cautioned that to develop programs locally using local funds may duplicate federal programs currently enacted to give relief to businesses and individuals. The governor wrote that I would prefer holding on to our local funding, which is needed to pay for costs up front by the local government to respond to COVID-19. It is clear that COVID-19 may be something that we will battle for many weeks to come. And then the press release came out again just before 8:30 from the speaker announcing that it was postponed. She said, upon receipt of the attached letter from the governor, I have decided to temporarily postpone session to allow for the coordinated effort of the two branches of government to come together and do right by our people. Given that this is a matter of life or death, during times like these, we really need to rally behind one plan of action, and I implore my fellow public servants to come together and join our MAGA haka.
I thought that was pretty interesting. And I heard from a couple of sources that the speaker and Senator Justin Augustine got called down to Adelup yesterday. So I'm pretty sure when they got called down, they were probably sat down and told that, stay in your lane. There's only one lane right now, and that's the governor's lane. So let's get the minority leader, Senator Telethon, up on the show. Good morning, Senator.
Good morning. Good morning.
Good morning.
So when did you find out?
Yeah. So when did you find out about this minority leader, Senator Telethon, on the line?
Hi. Good morning again. This is quite kind of a shock to us, especially with the minority caucus.
What's interesting is in the whole release that was sent out by the Speaker's office, it did include a March 16th release by the Republican caucus about Go ahead.
Right. This was very disappointing. We all got word that a release came out, and she attached an old letter that was dated March 16th, and it seemed very disingenuous what she was doing, because she sends out this letter from her along with the governor's letter, and then she attaches a Republican letter that was sent, a press release that was sent to the governor, but this was done on March 16th.
And this was done at the onset of the first 3 positive cases, and so you're saying basically the picture that the speaker was trying to paint was that the Republicans were on board with session being postponed indefinitely.
Right. Yeah, and that was very deceiving of her, trying to get, and there were several people who had called, and if I'm not mistaken, even Jim Moylan was mentioning this morning, he was on another radio show, and someone brought up, it looks like the Republicans are in favor of this. And he had to remind them, no, look at the date that the speaker.
Pretty slick move there.
Yeah, it was very deceiving what she did, and we had no idea this was going to be called off. We spent almost 2 hours on Zoom yesterday trying to coordinate the guidelines and rules of engagement for session, because the plan is to go in session virtually and video conferencing. Even the day before that, we were on Zoom again talking about going virtual in session, to keep everybody safe. And there's a couple members in the legislature that it's kind of like, in question, and whether they should in person be there. So
why is that? Wait, whoa, back up. Why? So you're saying there are several senators, your colleagues, it's questionable as to whether or not they should actually be in session. Why is that?
Well, without saying names, there may be someone in quarantine right now because of a timeline on their a trip that they took, and they're coming down with some cold-like symptoms. I mean, maybe it's just the cold or what, but just to be safe. And there's some of us who are caring for our parents who are very elderly. They're the main caregiver for them, and the possibility of getting infected, they just can't take that risk because they're responsible for that. Their family members, as well as even one person who had a husband who was in the Philippines, a part of that group.
The golfing group. Yeah, we heard this.
Yeah. Also, we're kind of weary about that. So going virtual was the way to go. But there was never any talk of completely canceling sessions. So when we got wind of this, we were really shocked to see this happen because the Republicans been working on legislation.
Mm-hmm. What time was this Zoom conference? And when you say that you had this, was it just the Republican caucus that was in the Zoom conference, or was it all senators?
All 15 senators was on this Zoom conference yesterday that almost lasted 2 hours.
What time?
Along with staff. This was around, I believe, 11. Let me get the exact time.
I was just wondering if it was before the 1 o'clock press conference.
Oh, right. Absolutely, way before that.
I see. So what we're able to piece together, Senator Tello, is that I don't know if we can get this confirmed, but that the speaker was called down to Adelup and probably given a good talking to. But you know what I don't appreciate? I don't appreciate the speaker's office dropping this bomb that we're not going to go to work for the people and then leaving us to deal with it. I think if you're going to drop a bomb like this and say that, we're going to postpone session indefinitely, even though we're supposed to be a separate branch of government that is supposed to provide checks and balances on the executive branch.
Exactly.
But you know what? We're not going to go into session because Auntie Lou's going to get mad. Auntie Lou's going to get mad because we're trying to roll back the BPT. Yeah. And are you concerned at all that the governor can snap her finger and the speaker can teleport over there, to Adelup or wherever, and the governor can basically tell the speaker, cut session, that's it, and then you guys are just left to deal with it? Because who's got to deal with it? The people, the comments are like, why aren't the senators going into session? I don't know.
We're going to be putting out a press release, I think, later on today, just so that we can let people know, no, it wasn't the Republicans that were asking to postpone this session. And we are looking forward to having this done, and for her to deceive all the media, to not look at the date on that letter and make it sound like
I wasn't deceived.
I wasn't deceived either, Senator. I look at dates.
Thank you for looking at the date. But some people have called in and actually thought it was something that.
Yeah, it was a slick move. It was a slick move made to look like they're trying to make it look like the Republicans also didn't want to have session.
No, we all wanted to. We were on chat last night wondering what is going on here, and then reading the letter from the governor and her excuse.
Let's look at this reason, Senator.
That was.
The speaker has decided to temporarily postpone session to allow for the coordinated effort of the two branches of government to come together and do right by. What does that mean?
Separate bodies of government. You said earlier that there's a check and balance here, and how can there be when we're allowing someone free for all, to spend whatever she wants, going into any accounts she wants to start spending. Now, granted, this is an emergency session, but there should be some accountability as to where and how much she's spending, and this money that's coming from the federal government. What exactly is she doing with that? Especially war claims. We're getting reimbursed by the federal government, and supposedly some of that money that was used for war claims on Guam pre HR 1365 passing was used by Medicaid funding that was supposed to be the matching grant that we were relieved from paying. Now, when that money comes to Guam, where is that money going to go? And in a Bill 181 that was passed, where they just ramrodded the bill through and didn't even allow us to speak on the floor to discuss what happens to that money once it's reimbursed to Guam? Where is it going to go?
Isn't there a bill?
Are you guys going to be like answering phones at Adelup? Because I'm not sure what the speaker means here. To allow for the coordinated effort of the two branches of government to come together. What are you going to be doing, Senator Tello, to coordinate with the executive branch of government? How are you going to be involved in this coordination effort?
That's a joke, right? You're being sarcastic, because the only calls we're getting from Adelup is just letting what everyone else is getting on the JIC, the announcements that are broadcasted on her Facebook page. But as far as finding out when is the report for the CRER report that's due on the 20th every month, we haven't received anything. She hasn't reported to myself directly or any of my Republican caucus on where she's transferring money out of which accounts. I caught that from the media.
Where's the Democratic leadership on this? Why haven't we heard a peep from the Rules Chair, Senator Regine Bisco-Lee, on the efforts to bring? I mean, the last we heard was that it was a crazy effort. It was gargantuan. It was impossible. It was going to take months to run through legal. Having a session with Zoom. Why? And are they just in lockstep behind the speaker, or are they scared to say anything because then they're going to get called down to Adelup too? What's the deal there?
I don't understand. It took us about 2 hours yesterday. We were just halfway through figuring the guidelines on what we're going to do for session, and everything was running smooth down to how are we going to submit our amendments. If someone wants to speak, how are they recognized to the speaker so that she can acknowledge us when we speak on the floor? It was running smooth. Everything, they had thought this out thoroughly, and even the day before we were on Zoom discussing how we're going to do the virtual conference or a session. So things were going well. In fact, I even announced that we should have a mock trial.
Like a trial run. A trial run, sorry, a mock session in the evening time. And, one of the senators said, oh, well, we can do it tomorrow morning. And I'm like, well, that's when session is. So Republicans were kind of figuring out why can't we do a mock session tonight? Why do they want to wait until tomorrow? Did they know something we didn't know? I think Chris and Sabrina, maybe you should bring a Democrat on here and try to find the same. Oh, good luck! I'd love to get a Democrat on here, but they're hiding. They're self-isolating.
I think you can talk to Senator Therese Chalahi and find out what's going on, or Senator Sabina Paris. They might be able to come on and let you know.
Senator Tello,
I think they're quite surprised as we are. I think there are a couple of Democrats in there who are quite surprised.
Right, and these are the Democrats who are not in. They're not the innies, right? So they don't get folded into the loop.
On their own. Yeah, they're the senators who think on their own.
Senator, let me ask you this. So in the governor's soundbite that we played before we brought you on, she had said that you guys are trying to provide direct assistance with local money is something that's already been done, being done federally. That's not really the case, though, because there are some bills, a couple bills there where you guys are seeking to lower the BPT, and then also I think the fuel.
Liquid fuel. That's
right.
Senator,
Right.
Yeah.
And let me just back that up, and then you can respond, Senator. Is that the governor's call? I mean, is she the one that's going to say, "Hey, this is what we're doing, deal with it"?
Right,
that's
exactly
what happened.
I want to know is that when she declares a state of emergency, does this give her carte blanche to do what she's got to do to get us through this time? And then report back later, like, this is how I spent the money, this is what I did.
I mean, does she have the authority to just, make you guys lay down for her? Because that's what it looks like happened.
Absolutely not. We are two separate branches of government. And like you said, there is a cross-check, between each other. And we have the ability to spend funding, and dictate how that money is supposed to be spent.
Oh, no way. So that falls under the legislative branch.
And that's even the question I had even before this all happened, the crisis happened, is where does she have the authority in law, which she answered that letter, by the way, to spend the excess revenue that was generated in FY19. And our legal counsel at the legislature said, no, we think that this opinion from them is wrong. So these two opinions are going straight to the Attorney General's office to determine, which one is right. Does she have the authority to spend this money, or it's been unappropriated, it's excess revenue? So it's just definitely a cross balance here, a check on both ends. And
now the only check is a blank check to the governor.
Well, that's what it's looking like right now, and it's important that the legislature gets into session and to look at all this. Now, the committee of the whole is very, very important, and that's what I'm thinking. Well, maybe the administration is afraid to bring people into the committee of the whole, and we already have the ability to, on Zoom, to contact them beforehand to ensure that they have an account. So when they're called into virtual session, it's just a matter of them, calling in and answering our questions.
Yeah, but Senator,
the biggest fear. No, I think that's the biggest fear is that we're going to be asking questions. Well, what is a financial condition today? What are you using with that funding coming from the federal government? Then why are you taking out from this area? Are you going to be reimbursing? We're going to get through this crisis, but we don't want to end up, where did all the money go? Why didn't you let us know it came from that area? Could we have, as a legislature, stop from you taking money out of the University of Guam?
No, you can't. Not if you're not in session.
Stop taking money out of the courts, which is another separate branch of government. We could be doing that, and right now by muzzling the legislature, trying to keep us from having session. It's not fair to the people of Guam. It's not us. It's not fair to the people of Guam. So this is very disingenuous from what the speaker did, sending out that media release and attaching an old letter from the Republicans to make it look like it's us. No. The Republican caucus wants to go into session. I'm the one that's been pushing for the virtual session to go through because I know the conditions of some of our colleagues and the safety of our staff. They finally adhered to it. I heard they were talking about this in their own group a week and a half ago, and it wasn't until Sunday we finally had a Zoom meeting, and then Monday going through the whole practice, and then boom, we get hit last night with no session. Well, not even a WhatsApp chat ahead notice from ahead of time from the speaker to tell us personally that this is her plan. We all learn about this in the media.
Sorry.
Yeah.
Yeah. Sorry. Don't take it personal. I was just passing the message along. Don't shoot the messenger, Senator.
No.
There's been a lot of people wanting to shoot the messenger.
No, I'm sorry. I'm very just very disappointed, and that we can't get in there to do our jobs. People are calling on us to go into session to address a few things, everything from quarantine issues, everything to providing funding now. Our people have been out of work for 2 weeks. That's a whole paycheck.
Hang in there. Hang in there. That was the advice from the governor. Hang in there.
No, they can't hang in there. Yeah, it makes it easy for someone to say hang in there when you have you have all the means in the world to survive. Then people who are paycheck to paycheck, and that one paycheck already passed, and people who actually float on the prior paycheck, Mm-hmm. And it's so disheartening. And they're supposed to hang in there with what? So we have an opportunity to get into session right now to address some of the issues, to start the relief program for businesses out there who've had to close their door. How are they going to be able to find hope, to reopen again? It's going to take a long time for them to do that. And we need to set some laws in here right now to give them that relief now so that they can adjust, knowing that this mechanism or this opportunity for business is in place today. Mm-hmm. It gets them to plan ahead. So, we're very frustrated this morning. A press release from the Republicans were going to come out this morning to say, please read the letter from the Republicans. It's dated March 16th. And I want to ask the speaker, and I hope she's listening right now, why did she attach an old letter from the Republicans on March 16th? What was she trying to accomplish there? to take away the fact that it was her, she's the one that called off session and making it look like it was the I'd like to know that. So yeah, I'm very upset, and so are my colleagues. So I don't know what else to tell you, but I'm please, people of Guam, call Speaker Barnes and ask her to let's have session.
Is anyone going to answer the phone if we call Speaker Barnes? Because I've been trying to call some senators' offices and we get no answer.
If someone is doing something wrong, I'm sure they're in hiding. But if they're not doing anything wrong, then have courage and get on the line and answer the questions that the people want to hear.
Okay, Senator.
Thank you so much.
Thank you.
Yoga.
Yeah.
Sorry to sound a little frustrating.
No,
light a candle. We have some coloring pages on our Instagram.
Yeah, please
Senator.
download them.
Coloring is therapeutic.
They're really nice.
Yeah.
Stay home, Guam. Thank you to heroes.
Yeah.
Yeah, absolutely. And I appreciate once again, like every day that you've been out there giving us information, and sometimes information we should know before the public, but we don't. But I appreciate everything that you're doing, and those out there that are doing their job. So, I'm asking the Speaker, let us do our job now. Call us into session.
And feel free the next time you guys do Zoom, just email us the link. Just kidding.
Well, we found a way, by the way, in the Zoom, virtual Zoom, and it can actually go on the legislative channel.
Nice.
They found a way, the IT guys found a way that we can actually do this in real time.
Yeah.
So you'll be able to watch session.
So that's
and people can
mechanism.
They can ask questions. No, if not if it's on Zoom.
I don't know, but
They'll be able to, yeah.
Obviously what you're saying, it's clear that you and your colleagues were moving full steam ahead with the intention to have session in 1 hour this morning. However, that was you guys were hit with a massive curveball, caught looking is how they describe it in baseball. That ball just went right by you into the media's glove. And
I think you should right behind you guys take a list of names of those senators back there who are not answering your calls, and telling them what they feel and what should happen. So,
I am just looking at the executive order, though, when the governor declared the state of emergency, and she has broad powers. It seems she can hire.
Except if she's going to stand up to the federal government, then she doesn't have the authority.
She can procure, and then it says here, all departments and agencies are instructed to keep appropriate documentation on all emergency expenses authorized by this executive order for inspection by the executive and legislative branches and by the public auditor of Guam, and in anticipation of federal disasters approval by the President of the United States. So, it seems like she does have authority to spend, to hire, to get us through the emergency, and then
to provide you guys to tell you guys what to do with your session.
Yes. Well, do you remember the letter that Senator San Augustine, this is the one we discussed earlier.
Yeah.
Okay, remember that letter that was sent to the governor, I believe it was March 25th.
Right.
Asking the governor, where does she have the authority to spend? It was pursuant to the Isla Guahan Emergency Health Powers Act, codified 10 GCA. And I think you might have had it March 25th, 2020. If you haven't, I'll be happy to send it to you.
No, we have a copy.
Okay, and it talks about given the limitations on how much she can spend as a governor. It's like $100,000 every month. A total of that should not exceed $600,000 for the fiscal year in emergency. This is guidance. They're requesting guidance of what she's using, the transfer of power that she has in this case. And I have yet to hear back from the governor, unless she responded just directly to San Augustine and Tina Barnes.
Did you tell Senator San Augustine that we were trying to get a hold of him?
I text him. I'm a woman of my word. I text him. I said, you need to call Chris Barnett. Why aren't you calling Chris Barnett? I even have it.
Well, we got an email from Joe Mescun, but that was it. So we're still calling on Senator Joe San Augustine to call into the program here and tell us where he stands on the money. I mean, he's the money man for you guys.
Exactly. He should be first on your list and put him on that billboard right behind you on senators who respond to your call.
All right.
And start checking them off. And the biggest question is, did the governor respond to that letter dated March 25th from the speaker himself, which to this day, he has not shared that information with myself or any of my Republican colleagues about this Attachment A 2020 General Fund COVID-19 Mandatory Quarantine Protocol. That's how it was titled, on a transfer out of funding of $4 million that she transferred out from the University of Guam Judiciary, even from the Attorney General's office. But we didn't get any of that. Now, from what I gather, this is supposed to be, I'm just, decided to give it Joe San Augustine. I'm not required to give anybody else in the legislature this. Well, that's fine. But Joe San Augustine has a responsibility, Senator San Augustine, to give it to us, to let us see what she's doing right now and where she's taking this money from. But anyways, I appreciate again, you guys.
Yeah.
I'll let you go.
Yes.
And, I think I did enough complaining. I should ask again, for the public to please call your senators and tell them, let's get into session. Let's do our job, and we can do it safely by doing it virtual conferencing, and it can be safely done. So there is no excuse, none.
I wonder if we're going to see anybody else call for session. If you guys have the votes, I don't know how logistically that would even work, but I'm curious because it seems like you guys should have another venue to meet and convene other than, the speaker sending a letter out saying, we're not doing anything for what is it, till further notice?
Yeah.
Okay. Oh, thank you, Senator.
Okay. Well, thank you so much. Thank you,
All right.
Sabrina.
All right. Take care.
Well, that was pretty interesting.
Yeah. You throwing your paper. Well, you are hot.
I'm just saying, this is just, you can't put something like that out and then not call or not, offer any clarity. Well, you can because they're doing it. Mm-hmm. And there's no doubt that the governor needs the authority to do what she has to do during this public health emergency. And I think she's shown that she is doing what she has to do. But that doesn't mean that the senators should go stick their head in the sand. It doesn't mean that at all. Mm-hmm. There's a role for them. Clearly, they are one of the branches of government. And, I'm pretty sure you guys don't need a civics lesson. It's 9:03. We're KUAM-FM, Agotni, Guam. We're coming back with some tips from public health. How's that? Is it going to be nice and fluffy? Get some tips from Francis from public health. It's Containing COVID, the KUAM News Takeover, Guam's favorite I-94. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Day Guam. This is Rocky Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please stay at home and stop the spread of the virus. Thank you.
This is Tomas Maglonia on the island of Saipan, reminding you to stay home as much as possible. And when you have to leave your home for essential things, practice social distancing. Remember, you can still keep in touch with your loved ones online. We can get through this as one archipelago, one Marianas.
Day Guam. My name is JJ Ambrose. That's Juliet. This is Isabella. And that's Applejack. For the last 2 weeks, pretty much since she was born, we've been stuck at home in quarantine. I miss my friends. I miss family. I miss going to the beach. And I definitely miss going to school athletics. But the silver lining is I get to spend more time with them. We've been catching up on homework, working out, and I've been changing a whole lot of diapers. But I know there's an end to this. We've been doing our part. We're asking you to do the same thing. Stay home.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now I know
You know what? I think we should start coming up with ways our senators can pass the time, since they're not going into session until further notice, right? We do have some resources. Maybe they can check out DOE's online learning resources. Breeze, like you're on your own over there, Chris. 909, it's containing COVID here on Guam's favorite. Jay, we got a bunch of comments. You want to do those? We got Francis from Public Health that's going to jump on the show and give us some tips. But thank you guys so much for watching our Facebook Live feed. Jay, with some of the comments that we're getting this morning?
Yeah, there are actually a bunch of different side conversations, and this is why we love our Facebook community so much, because you guys actually respond to what we're talking about. You guys actually spawn and start all your own sub-threads and your own conversations, everything. A lot of people are bringing up they want more transparency from the government. People are just saying, everyone in the world seems to be using Zoom right now. Why can't the legislature? And why can't more of GovGuam? GovGuam is using it.
That's what she said, that they met over Zoom.
Yeah, the issue wasn't Zoom. They were, there was a 2-hour meeting yesterday for them to figure out how Zoom works.
I think one of our Facebook fans, Charlotte, I think she's well on her way to top fan status, because she's having some great conversations. And she's saying, can people make all of these Zoom sessions live? And what we learned yesterday is, of course, we know that if you are a Zoom host, you can stream live to Facebook, you can put it on YouTube, any of the major social platforms, right? You can make that a publicly viewable event. As Sabrina, I learned from Saipan, you can also open it up to the community at large, because when we were waiting for the Saipan press conference to start, And by the way, the Saipan folks over there are doing a fantastic job. They actually invited all the media. And then as we very quickly learned, because I was like, oh, Bree, there's you, there's me, there's Tomas, who's reporting for us in Saipan. There's our colleagues from, the PDN, the Guam Daily Post, and all of our friends. And then all of a sudden, I was like, are you seeing the participant count? It went from 6 to 26 to 206. And then it capped out at 300 because if you use the free version of Zoom, and they basically invited the entire community to take part in that.
I don't think they knew that that's
Yeah, they
what they
didn't
did. I
know.
think
Yeah,
was,
well,
the link was leaked.
It very quickly became intractable, but it is possible if you do that. And that's some of the conversations that people are having right now. Also, some people are wondering about, like you said, what options are there for public school students to continue their classes? Because some kids are like, hey,
Right.
I'm home, I'm bored, I
Right.
want to do something. So
I'm bored.
Go to www.gdoe.net, and they've actually put up some really cool infographics and posters about what you guys can do to make sure that you can continue your learning. Because if anything, it's giving you guys something to do. But we are going to have a little bit of a segment coming up after Francis on what other institutions of learning are doing to make sure that you can learn while you're at home.
All right. Thanks, Jason.
All right, there you go. Jason saw this, of course, and let's get Francis on the line here. Francis from Public Health. Good morning, Francis.
Good morning, Chris.
So, Francis, what division are you with, and what are you going to share with our audience this morning?
Oh, yes. First, I'm with ECHO, the Education Community Health Outreach of the Public Health, and I'm with the Division of Environmental Health, actually. I work there as a health educator. And one of the things I would like to announce to the public is that, I know you have read this and seen this, is that Public Health extends the health certification expiration date.
Mm-hmm.
So for those health certificates expiring from March 16, 2020 to April 13, 2020, will be extended until further notice. Now, if there's any one of the out there who's having the refresher and interim food safety health certificate training course that was scheduled from March 16 to April 13, they will be rescheduled with no fee once the processing center section opens. Okay, and if they would like to know more about this and would like to ask questions, they could call our processing center section number at 300-9568.
Francis, so let me get this straight. You are from the division that goes out and inspects the restaurants and does the health certificates and stuff.
Oh, yes, sir. Yes, I
Okay.
do.
So are you guys doing any type of site inspections or visits, given that we're now having a lot of restaurants doing the
Right.
takeout thing? Or are you guys totally grounded?
Oh, no, actually, as far as I know, they do go out and inspect those restaurants who are providing services and takeout, and they're out in the community right now.
Oh, so they are. You said they are doing inspections? That's what.
Oh, yes, they do.
Oh, okay.
Yeah.
Right. And what types of violations are you seeing as people try to, adhere to these social distancing and the additional safety measures that are there additional safety measures that you guys are requiring in light of the COVID-19 outbreak for food establishments?
Well, so far, the guidance memo provided, DPHS Guidance Memo 2020-02, one of those requirements which took effect Monday, March 30, 2020, is that retail operations and other customer-facing services must enforce social distancing and then provide access to both employees and customers, patrons for hand washing facilities. And you need to post a sign of a conspicuous place at all public entries for those persons who have symptoms of COVID-19. If they have cough, fever, and difficulty of breathing, okay, those should be posted. And so those are the things that I know our officers are doing once they go out in the field, Chris.
Okay, so these are the guidelines that you follow by the FDA.
Oh, yes, ma'am. Yes.
People wonder, Francis, I don't know if you can answer this, about how safe it is to pick up food and if COVID-19 can be transmitted, through the contact that happens when people package and prepare food. And what do you guys, do you know, is there science on that? What do you know?
Thanks for the question, Chris. Actually, there is no evidence of food or food packaging being associated with the transmission of COVID-19. COVID-19 is a respiratory illness and is not linked to the exposure of food or food packaging. And this is according from the Food and Drug Administration, who provides us guidelines on these matters. And actually, FDA recommends the following precautions for our food establishments that they may take at this time. One is which is frequent hand washing and glove changing, frequent washing and sanitizing of food for contact surfaces, frequent sanitizing of counters and tabletops, and implement social distancing measures, and discontinue self-service operations and salad bars until social distancings are lifted. And if an employee is confirmed to have COVID-19, the employee should inform the local health department immediately for guidance and redouble cleaning and sanitizing of food contact and food contact surfaces at their establishment.
Right.
Now, if there's any violation of this, they could report this to the Division of Environmental Health, and the number is 300-9579.
Francis, we do know, however, that COVID-19 has passed through fomites, I believe is the term. And
yes,
so
true. That's really true, Chris, yes.
Right, and so I'm wondering, because there's evidence that the virus can survive on plastic and steel, if healthcare or food service workers are wearing the gloves and stuff, does that minimize that? Because you're saying that there's no evidence of it being spread, but there is evidence of it being transmitted, through surfaces. We're being told to clean the surfaces all the time.
Mm-hmm. So, as far as I know, yes, it's transmitted through fomites. That's why it's one of the requirements that we need to always clean those surfaces that's being constantly touched. And with that, wearing gloves, I'm not so sure. I might get back on you with that, Chris.
Right.
But then again, those are good questions. And maybe later on I would find some more answers on that one. But yes, you're correct. Yes, it's transmitted through fomites. Those are, especially if it's those plastic or steels. That's why it's very important that we need to keep on cleaning and sanitizing these surfaces that's being constantly touched by people.
Okay. Anything else that you wanted to get out to the community, Francis?
Oh, thanks, Ms. Sabrina. Yes. Thank you for always washing your hands no less than 20 seconds. And thank you for keeping social distancing as a practice. I know our community is very good at that now. Each time that we go to different retail establishments, we see them, they see the line and they observe that. And thank you that if ever you have symptoms that you think you have COVID-19, don't forget to call our medical hotlines 480-7859, 480-6760, or 63, 480-7883. And thank you for taking good care of each and every one of your family out there. And thank you for staying home, like what Chris said in this nice video that he made.
Very nice, very nice.
Gone viral.
It's really cool.
Francis, I wanted to ask, is there anybody at Public Health that goes out and not necessarily inspects, but maybe monitors places like Guma Tranquilidad?
Oh, I know all of our public health staff are out who are ever responsible to it. But yes, I do know they do go out. But as of the moment, for me, my only I'm assigned with the ECHO, Education Community Health Outreach.
Okay.
But rest assured, I know each and Guam agency involved in this pandemic, they're all out there doing their part in preventing COVID-19 in our community. Thanks for the question.
And we definitely appreciate that. Francis, thank you so much for your time this morning.
Well, thank you, Chris, Sabrina, and thank you, Jason, for your time and having us in your station.
All right. We'll talk to you again, hopefully, next week.
You let us know. You got the number, Francis. You call anytime, okay?
Oh, yes, we will, Chris. Thank you so much.
All right. Got it. Francis.
Stay home. All right, so the number again that he mentioned for anybody that has to report any potential food safety violations, you can contact Public Health's Division of Environmental Health. That number is 300-9579, 300-9579.
CBS Primetime Tonight kicks off at 8 with The Neighborhood.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Buenas and half a day. Mabuhay. What's up, Guam? I'm Norm. If you're watching this from home, then great. But if you're somewhere you don't have to absolutely be, please go home and stay there. I know it's difficult for us to change our routines and habits, and personally, I'd rather be with my family and friends dining in a restaurant or going to the movies. But the timing, it's just not right. We're asked to make a little sacrifice now, but in the long run, it'll help to ensure that you and your loved ones remain safe. We're dealing with an unprecedented health crisis, and we need everyone's cooperation. Let's fight the spread of the coronavirus by doing our part to stay home so that Guam can stay safe.
Hello, 94. Let's go to the phones where we have Natalie. Natalie, good morning.
Good morning.
So you had a question here, public health related. What was your question?
Yes, I didn't hear if you mentioned anything about face masks while preparing or servicing food, because I know it's transferred by fomites and droplets. So are they required to wear face masks?
It doesn't say this on the information for stakeholders and consumers that was provided by the Joint Information Center, which he was basically mostly reading off of. It just says that the FDA recommends the following precautions that food establishments may take at this time. And as he mentioned, it was hand washing, glove changing, frequent washing and sanitizing of food contact surfaces, but nothing about wearing a mask.
Wow, yeah, that's interesting. I actually picked up lunch somewhere yesterday, and I was given to me to go all wrapped up, no mask.
Yeah, but there is a phone number here. It's 390-579.
What do you think, though, Natalie? Do you think that they should be wearing masks?
I believe that they should be wearing a mask if you can contract it through fomites and droplets. I mean, if they're talking all over your food while they're preparing it, or they could be talking over the foam plate that they're going to give to you. Regardless if they're using gloves, it could still be transferred.
Wow, I'm eating in today.
Yeah, I try to stay away from even the drive-thrus.
Right, and you're seeing a lot of the drive-thrus. Nobody's wearing nothing. No gloves, no mask, no nothing.
I see Wendy's drive-thru. I see them wearing masks.
Okay.
I haven't been around, staying home, self-quarantining.
Good for you, Natalie.
Wearing that.
Okay, well, yeah, we're gonna put Jason. Go ahead.
Okay, actually, hi Natalie. I was also gonna say, some of the fast food places, now that everybody's operating drive-through only, some are getting very, very creative. I saw in McDonald's for the past few days, they're actually, typically their staff have masks on anyway, but they have like a little tray that they say if you would like to either give cash or give like your if it has a card, they extend the swipe machine and you put it in yourself. Otherwise, they give you like a tray and they pass your food the same way, so they're not coming into contact with you or your stuff. So that's a little bit of the creativity that some places are coming up with.
Yeah, I'm still kind of OCD about the germs. So if somebody before me touched it and was infected with it, now I just touch the pad that they just touched.
You kind of sound like you'd get along really good with Sabrina.
I heard about her so-called hoarding of cleaning.
I don't hoard.
Yep. See, words out, Bree.
I don't.
She's making her own hand sanitizer here.
That's what's interesting.
Hold that up to the
Natalie,
camera. That's cool.
Maybe Sabrina could give you some pointers. She's actually cooking up her own hand sanitizer blends.
Do you do that, Natalie?
I do like to make some homemade cleaners. It's just I can't find alcohol or aloe vera.
Yeah, see, I think I had the last batch of alcohol.
Yeah, that's where the hoarding comes in, Natalie. That's where the hoarding comes in.
I do have aloe vera plants, and I did see a do-it-yourself one using a blender with aloe vera and alcohol. But then again, we can't find alcohol on the shelves as well.
Yeah, it is hard to find.
Yes.
And I promise I don't have all of them.
I'm just going to get out of the way so you guys can... I think we got new BFFs here.
Email me, Natalie, Sabrina@km.com. Exchange, maybe Zoom, you know.
Yeah, maybe you guys could do a Zoom tutorial. Thank you, Natalie, and that is a really good point. You're right. I want to see masks now that I think about it. I mean, the people talking over our food. And, when you watch a lot of these national videos about how the COVID-19 is spread, I mean, they even say that someone who has it could sneeze in a room, and you could walk into that room 10 to 15 minutes later and still absorb the droplets with the, COVID-19.
I believe even after we pulled through this whole COVID-19, even before, I felt that restaurants, any place that serves food should just wear masks, period, because I don't like people talking over my food while they're preparing my meals.
That's true.
Okay, I've got a life hack if you guys have a sec. Okay, so I've also wondered, because I've gone to the ATM a couple times, and my thing is, of course the banks are saying, we may close our like normal person-to-person hours, but banking and financial services remain open. So of course everybody's going to the ATM. If you don't have enough hand sanitizer to actually sanitize and wash down the buttons themselves, I actually take a penny from my desk or from home. I go there, I touch all of the buttons on the ATM with the penny, and then when I'm done with my transaction, I throw the penny away.
Wow,
You
life
throw the
hack.
penny. You throw the penny away.
I throw the penny away. So there's maybe like 6 or 7 pennies, like in the trash can right now.
Natalie, I just want to say that yesterday Sabrina went over to the ATM over here, and she actually
ratting me out.
She called me and she was like, "Can you bring my Lysol and my wipes?" And I was like, "Why?" And she was like, "No, because I'm at the ATM and I don't want to touch the buttons." So I don't know if she sprayed the buttons and then with the wipes. How did you do that, Bree?
I use the wipes like a glove because I didn't have my gloves. You couldn't find them, so I used a glove and I started pressing the buttons, grab my money, everything like that. Then I wiped it down for
So
the
you're
next
welcome,
person.
people of Guam. She's sanitizing. We got a comment. Hey, is Gov Guam going to disinfect the streets? No, they don't have to, because Sabrina is.
Stop.
I would do the same thing. I would have a bleach solution in a little spray bottle.
Yeah.
And a little COVID-19 trash bag to throw all my unsanitary stuff in there after. Just spray it on a little napkin, wipe it down, and throw it in the bag.
That's my girl.
Okay.
Oh my gosh.
All right. Love fest in here. Thank you, Natalie.
Thank you all.
Okay.
Bye.
Wow. Here I was thinking you were one of a kind.
We are bonding.
You are just like everybody else, apparently. So we had something from the JIC you can do there, and then I'll try and get a hold of the mayor.
Actually, no, I don't. But the late. Jason, I know you wanted to talk about the Department of Education. They started their distance learning.
Yeah. So again, for all of you public school students and faculty and administrators, you guys are watching right now. Thank you very much, and you're listening. GDOE has been very, very diligent, and go check out their website right now because it's www.gdoe.net. Check it on whatever device you may be watching us on and see what they're doing for distance learning programs. This is also interesting because at UOG, the concept of distance learning was always something that UOG always defined as, okay, well, UOG has classes, and if students from the other outer islands would like to participate in them, they can do so. Now you're getting kids who live right down the street from UOG doing learning.
That's right. And then I believe on the April 6th, they're going to have a weekly instruction that will be supported for elementary, middle, and high school students. So, and I think that's with teachers, right?
Yeah, St. John's, I know, is doing online learning. As we've already said, the University of Guam is basically a 100% online learning facility, at least for the remainder of the spring semester. And I did have something that I cribbed, that I stole, basically, off of one of my friends. Tracy Parrish, she is a teacher down at Inaran Elementary School, so thank you, Tracy, for this. She put it on her Instagram.
Wait. Let me preface this by we're about to get poetic.
Oh, yes.
So Jason is there's a poem that was written by one of the teachers.
Yeah, and so this is a poem in the spirit of Dr. Seuss. So if you guys want to hear anything, if this doesn't brighten your day, I grew up the son of 2 educators, so I know what it takes, the commitment that teachers have to make. So here is real quick. It says, "My life as a teacher now." And think, this is in the spirit of...
Why don't you go on the other side and face the camera?
Oh, okay.
Yeah, I mean...
Okay, so imagine Dr. Seuss writing this, right? "My life as a teacher now. I will teach you in a room. I will teach you now on Zoom. I will teach you in your house. I will teach you with a mouse. I will teach you here and there. I will teach you because I care. So just do your very best and do not worry about the rest." Now that's being passed around. It's all over Instagram. It's all over everybody's Instagram stories. The education community really showing that they are committed to making sure that students can succeed. And even though we live in very weird times with, accommodations being less than perfect, we can still do this.
Thank you, Jason.
Beautiful poem.
Yeah, that was great. 9:30. Well, we've done it all this morning. We've, had poetry even.
Yeah.
And
we
shared
need a
recipes for hand sanitizer.
Hey, Natalie's my girl, man.
9:30. Let's get the president of the Mayor's Council in Guam, Mayor of Dedido, Melissa Tavares, on the show. Morning, Mayor.
Hi, good morning.
Good morning.
We just hadn't heard from you in a little bit and kind of wanted to find out, as the head of the Mayor's Council of Guam, what's been going on with the village mayors?
Well, those of us that have our senior citizen centers, we continue to issue meals to those that are registered seniors in our centers. Last week, we were also, some of us were also helping deliver meals to the homebound because some of their drivers were not able to come to work. And so we did that for a few days. Our offices continue to receive requests for people who are renewing their public assistance applications as far as their food stamp and Medicaid applications. So we are doing phone calls only if there's residents that still need those there's verifications, and we are emailing it directly to the caseworkers. Public health caseworkers are still working on the renewal process, and of course, as you know, there are many residents that have shortened hours, so they feel that they may qualify for the food stamp program. So what we're doing is also preparing those documents, the verifications that they live in the communities, and sending that to caseworkers at public health. So, and then, some residents, we're also helping with traffic control at the various schools in Dedido. We have 3 schools that have the meals grab and go meals for the children 18 and below. So our staff are out there assisting with traffic control for those particular schools that are, giving food out to the children as well.
Mayor, I wanted to ask you, so we had several of your colleagues on the Mayor's Council of Guam talking about what they felt was the need to know if any COVID-19 positive patients were in their villages. And we talked to a few different mayors. What are your thoughts on that? And have you heard one way or another if the village of Dedido is housing any COVID-19 positives that are in home isolation?
I know that we have a small number, and those are isolated they're quarantined in their homes. I know the concerns from my colleagues were who's policing them to make sure that they're staying indoors, they're not outside, not roaming around. Of course, public health does make contact with those. If it's not directly to their homes, they're calling them. I've had 2 residents that said they're on quarantine, and they continue to get calls from public health. I had one resident who said he emailed us and said his family's in quarantine. What can he do for food? And so I replied to him that if he needs something, we can bring him non-perishable stuff. That we have some donations of non-perishable food that have been donated. If he just lets us know where he's at, we would send that to him. He replied that he's okay right now, but should his quarantine need to go longer, they're not symptomatic though. If their quarantine needs to get longer, he will let us know where we can deliver to their doorsteps or their front door, so that they can at least get that.
How were you able to find out that there were COVID-19 positives in your village? Was this just something that the patients themselves offered willingly?
2 of them had actually emailed us and said we're on home quarantine.
Home quarantine or home isolation?
Home isolation, I'm sorry. Home isolation. And it was the entire family, because they were exposed. So, we did email back and ask if they're symptomatic. Said not yet. They don't have any symptoms, but because they were exposed to somebody who was also they're in isolation at home. And so, of course, their concern was, what if we need food? Another concern that, he gets medication. One individual from the family needs to refill medications. And we said we can help where we need to, where we can. When we can, we'll work with the pharmacy, show them our credentials that, we're picking up medication if they call it in. But, when concerns like that come to us, we're ready to assist. The delivery will be, of course, with caution. We have masks.
What do? You put the bag on a really long tongan and just kind of stretch it out, or?
No, especially like when we were delivering meals last week, Chris and Sabrina, what we did is, we informed the seniors to put a chair or a small table by their door, and we will deliver it. They don't come out, so we don't have contact with them. But when we leave, because we honk the horn when we get there, we see the chair, and then when we're in our cars is when they open the door and wave at us. So we have no physical contact with them, and where there is social distancing.
Mayor Savaras, we had the governor on the show yesterday, and we asked her about addressing the homeless population because 2 of the positive patients are homeless, and she did say that they are looking at options to provide some sort of a shelter for them, or shelters for homeless people. And I'm wondering, has the Mayor's Council of Guam been folded into that discussion?
We did have a discussion with the communications team with the governor's office and Dr. Cabrera on Sunday via Zoom. And of course, the concerns were keeping people out of our parks and making sure that social distancing is practiced in the community. And that was something that Mayor Rivera brought up, as the homelessness and the homeless community. And because she says in her parks, at their pavilions, there is no social distancing when there's 2 or 3 of them under a pavilion. And so, of course, the concern was continuing to educate them and seeing if there's another place that we can isolate them at. But we haven't heard yet. I know that the governor is working with their housing team to find a facility that they can go to where there will be social distancing.
Okay. So since Sunday, no other communication about...
Not yet. Not at this time.
Was there any indication where that facility might be, or if it'd be multiple facilities, or in northern Guam, southern Guam?
We're not quite sure. I believe it's somewhere in central Guam that they're looking at.
We had heard Agana Pool area. Did you hear anything about that, Mayor? I checked with Agana Mayor, and he didn't know.
No, I don't know anything about the Agana Pool area.
Okay.
Okay. And just also, heads up, Mayor, we got a comment here. Mayor, what about the residents across the Stumbo Elementary School, trash piled up around the house?
We've addressed that 2 weeks ago. We took some stuff out. We need this family to sort out through their things. They continue to pile. I drive by there because, like I said, Stumbo Elementary is one of our distribution sites for grab-and-go lunches for the children, and so I continue to make contacts during my drive-bys with this particular family, and we're working with them to reduce that pile. Okay?
Thank you, Mayor.
Right. Anything else you wanted to get out?
We've barricaded our parks, especially our basketball courts, because there is no social distancing when you're playing basketball. There's that physical contact sometimes. And so we've barricaded those areas. We just want the community to, when you see caution tapes, things roped off, please,
that means stay away. That doesn't mean go up close and see what the caution is about.
Right.
Yeah.
Okay.
Thank you, Mayor.
Okay. Have
Thanks
a good
a lot.
Wash your hands, Mayor. Oh, there you go. She's the president of the Mayor's Council of Guam, Deputy Mayor Melissa Savaras. And wow, so she has the COVID-19 positives in her village. And interesting to hear her talk about how they do things like go and refill their medicine for them. So, and these are patients who are obviously asymptomatic, right? That's got to be tough mentally. I mean, to be in a home isolation and you feel totally fine.
Mm-hmm. And then there was the one she said that reached out to her about if she ran out of, if that person ran out of food,
right?
Would they be able to assist?
Jason, you look like you want to say something, or no? Okay, definitely.
And then what was it? Linda DeNorsi said starting today, the isolation facility in one of the hotels will be opening up, and they will be moving people. Yeah.
Yeah, we just got a release here from Public Health. I sent it to you. You see that? And this is Physicians Alert on commercial testing for COVID-19, available through Diagnostic Laboratory Services, or DLS. Linda was able to talk a little bit about this this morning, and basically what it means is, I'll go ahead and read it.
Okay,
Oh,
go ahead.
go ahead.
Go ahead.
Yeah.
No, go ahead.
Yeah.
Okay, effective March 31st, commercial testing will be available through Diagnostic Laboratory Services. Healthcare providers can now refer specimens from patients who do not meet the criteria for priority group testing directly to DLS. COVID-19 testing is covered under Medicare, Medicaid, and MIP. If you have mild illness and want to be tested, contact your healthcare provider. Guam Public Health Laboratory testing remains limited to the following priority groups: hospitalized and ER patients, patients scheduled for urgent surgery, people with chronic diseases at any age and COVID-19 symptoms, healthcare workers and first responders with COVID-19 symptoms, older people, pregnant women, and very small infants with COVID-19 symptoms, and indigent patients with COVID-19 symptoms lacking insurance. Again, effective today, commercial testing will be available through DLS. Healthcare providers can now refer specimens from patients who do not meet the criteria for priority group testing directly to DLS.
Okay, so I wonder if that's going to lead to more people going to the clinics. Is there going to be increased traffic? I think we probably should get a hold of one of the doctors.
And didn't Linda say that the tests that are ran through the DLS lab, it will take a while longer, right, for the results to come back?
I think she said 3 to 5 days.
Right.
Yeah, and so of course, like we always do, the people call the show. We go back and we separate all the interviews and we put them on YouTube, and then we also, cut them up for the news because, man, and the nearly 4 hours we've been on, there's just been so much information, valuable, helpful information that needs to get out there. So that was one of the things she said. So this is interesting that the commercial testing is going to take longer. So what does that mean with public health testing? We know that Linda had said that 5 of the presumably, if we're testing at full capacity or running 40 tests, so 5 of those are going to be dedicated to the CNMI.
Mm-hmm. And the fact that public health also, they do the testing for the entire region. So we're not just talking about CNMI, we're talking about Palau and the FSM.
My kids are just sending me the grab and go pictures.
Good meal today.
Yeah.
They started the breakfast meals.
Yeah, so we had a comment on that. They start breakfast today. It's the same hours. It's going from 11 to 1 o'clock, right?
Mm-hmm. At the 11 different sites.
And I just want to say thank you so much to the Guam Department of Education employees and the other. There's different agencies. I know the mayors and their staff have also helped out with this whole grab and go program to get 12,000 plus meals out to people who need them. It's not easy. Mm-hmm. It's definitely not easy, and it takes a lot of moving parts, and more importantly, it takes a lot of moving people. And so thank you guys, and I really think that this is a program that we have to appreciate this morning because a little bit up north in the CNMI, they've canceled their grab and go program except for the island of Rota.
Yeah.
And they were giving out 10,000 meals, and the statement that came out from the CNMI was basically, hey, we've done our part to get you guys fed, but now it's time for you guys to respect our desire to keep our friends and our families safe.
Right. And then, as we told you, there's 2 confirmed cases, and there is 1 suspected COVID patient death. The results are still pending with public health. There was a unsecured swab that was sent to Guam, so they're having to resend it over to public health here.
9:45 containing COVID. Wanted to end on a positive note here. I also have a special performance from my friend Candyman. Bree, this is something I saw on Facebook last night from one of my friends, Felicia. And this is a Facebook post she posted last night, 7:53. So in light of the COVID-19 pandemic, my family and I have decided to cancel our vacation this summer. However, I have 2 United travel certificates that I will be donating to a family in need for medical purposes. Please share my post. One is already claimed for a boy who has to travel to LA because he's having he has nephrotic syndrome. I have one more available. message your story or a story of someone who needs a helping hand. Thank you and God bless, Felicia Cruz. And that really is. You okay over there?
Yeah.
I mean, it just, and I have Felicia on the line. Felicia, good morning.
Hi, good morning.
First of all, thank you. Bria's tearing up over here in the studio. Just take us to the beginning. Everybody had vacation plans this summer. At what point did you guys decide that your summer vacation wasn't going to happen? And I'm reading that it was more than just a summer vacation, right? You had big plans this summer.
Yeah, I'm supposed to be graduating in California, so I wanted to take my kids and just take them to Disneyland, make a trip out of it.
And that obviously is not going to happen anymore. And so where did it go from you deciding to cancel that? Obviously, graduation's all up in the air. When did it go from that to, hey, let's give people an opportunity to win these certificates for people in need?
Well, I mean, you know, it's always good to help other people, and I know a lot of people are struggling right now. So if I can't use it, I don't want to waste it, so I'd rather just give it away.
Can you tell us about the reaction you got? I know that there were quite a few shares and some comments. Maybe if you can run through some of the comments that you got.
Well, all of them were positive, of course, and I did get a few stories, and last night I was just reading some of them, and, you know, it's really heartbreaking how with all this COVID situation going on, there's still like, you know, there's other things that people have to deal with medically. So, like, it really did, you know, it kind of breaks my heart just to see so many people going through different struggles.
What were some of the stories that you had heard about? You know, of course, you don't have to give us specifics, but just some of the details that you heard.
Some are cancer patients, majority kids going through this. You know, their parents were reaching out to me, and it really makes me sad because, you know, I can't help everyone, you know. But for the two people that I am helping, like, you know, I'm glad it's something that I'm so sorry. I keep crying. I'm just glad that I'm able to help at least two people, you know.
I don't know what to say, Felicia. You're getting me kind of. I'm not gonna cry. I'm not gonna cry. But it's getting to me because these are things that we struggle with, even when it's not COVID-19. You know what I mean? People have a hard time with medical fundraisers. It's crazy. And, you know, I didn't even think about that, how these people who need continuing medical care, how they're dealing with this lockdown, with everything that's going on with the quarantine. And for you to kind of make this decision that, you know, we can't graduate, we can't go on vacation, that's one thing. But to turn it into such a positive for the people who you have helped. And can you tell us, this is all part of Pay It Forward. I know Jason was showing me that this truly is Pay It Forward.
Well, you know, I see a lot of people, like restaurants, they're giving food to those people that can't really afford, you know, certain things right now. So, I mean, seeing that, like, you know, makes you want to give to somebody else. So it's all about everybody helping each other.
Amen. Can you tell us about, so one of them went to a boy with nephrotic syndrome, and then how did you decide on the second travel certificate? Because Lord knows this must have been a very tough decision for you to make.
It was. So, I mean, I just read her story, and her son has lupus, and my previous boss had lupus before, and she told me, you know, it's really hard dealing with it, you know, and this is a 12-year-old boy who has to go through this, and I just thought it was so heartbreaking. So, he was the one that I decided to go with.
Wow, Felicia. We're getting some comments here. You have a big heart. Candy writes in, Felicia and I used to ride the bus in high school together. But Felicia, I've been seeing you for years. You worked at a restaurant that I always bring the kids to. And so, yeah, I've seen firsthand. You're very generous. You're very kind-hearted. And we can't really thank you enough. And we only hope that this example that you've set, because there are probably a lot of people who have had to cancel their summer vacations, and maybe we're going to start seeing more people kind of do what you did, is find a way to get these certificates or convert the tickets or do what they got to do to get it out to people who really need to go.
Yeah, of course.
All right. Thanks, Felicia.
Thank you, guys.
Okay.
Have a
Felicia, I got to say bye, Felicia.
Bye, Felicia. You probably get that a lot.
I'm sure.
Yes, I do.
Right. Okay, well, God bless you, girl.
Same to you. Okay. Be safe.
Be
and
safe.
Wash your hands, okay? Always. Well, there you go. Felicia Cruz. That is a COVID hero right there.
Yeah.
And really, we
Another
try.
angel among us.
Yeah, we really try and give this part of the show the last word. We try and do something positive to kind of send you guys on your way. To, put things in perspective. We're all going through a lot, but
going through it together too.
We are, yeah. And so 9:53. Bree, did you want to do that Payless thing? So there was a big thing that came out from Payless.
Oh, yeah, because when people are going to the grocery stores and then going home afterwards, Payless Markets, they announced additional COVID-19 policies effective Wednesday, April 1st at 5 a.m. Payless will be implementing the following precautionary measures that comply with the directives that were set forth by Governor Lulian Guerrero. They will enforce social distancing measures by requiring that customers and employees stay 6 feet apart during their shopping visit. In order to support social distancing, Payless will control the number of customers who enter the store at any given time. Customer limits will be as follows: in Maiti, 75, the Micronesia Mall, 75, Dedito and Jigo, 55, Oka Payless, 50, Mingilao, 30, Sinahanya and Sumai, 25. Payless personnel will be assigned each store to assist with customer limits. Also, Payless will not allow entry to customers who are experiencing respiratory illness, including fever or cough. Additional safety precautions, Payless will be implementing the following COVID-19 policies. They will require all customers to wear a face mask or protective face covering while shopping. Also, starting Wednesday, April 1st, Payless will temporarily suspend their Mission Zero Bags program.
Thank you. Sorry. I'm sorry. I always go to Payless on a Wednesday.
Yeah,
and I never bring the bag.
And that is so me.
Yeah.
You're right. Thank you.
Could I just add something? Because I shop at Payless, and I've gone to the mall, and I've gone to Dedito, where I live. And Dedito has actually done a really good thing too. Is I just noticed it, I guess, last Saturday, but now they put like these big stars, these big like labels on the floor, 6 feet apart, so if you're lining up exactly how far you need to be. And like I said, people are getting creative. I mean, it's responsible, and they're doing that. And at the mall too, they have like a big rack because they have like those baskets that you can carry. And think about it. How do most people carry the baskets? Mm-hmm. On their elbow, right? So they have a whole rack of them.
No, I don't.
No, that's not how you. Well, I do, and they said when you sneeze, you're supposed to put it in your elbow. But they have a whole rack there, and they say we constantly sanitize all of our baskets. And as soon as one customer is done with it, they have someone who run. It's like almost like Disneyland. You drop like a gum wrapper at Disneyland. Not even 3 seconds. There's like somebody comes there and sweeps it up. Payless is really diligent, and I've seen it like that. They go there, they take your basket, they completely wipe it down, they put it back in the sanitized rack, and for new customers coming in, total.
All right. Thanks, Jason.
Total reliability.
Thank you.
Jay.
Again, starting Wednesday, all right, all customers wear a face mask or protective face covering. This is Wednesday, April 1st.
Okay, last song here, 9:56. Sabrina, good job today.
Good job. Good job, everybody.
I'll leave you with my friend Candy doing a little cover and a little message for our audience out here. Hey, this has been Containing COVID, the KUM News Takeover, Guam's favorite, I-94.
Bye.